Hi,
So,
Sarah.
hi. Hi, everybody. I'm Sarah Stalder, and I am excited to be here this morning. I always get excited when we have more nursing students coming in, just because it's wonderful that we get to be in this profession, and I'm excited to eventually have you guys as coworkers. So, a little bit about me. I'm a psychiatric nurse practitioner, and I teach in the undergraduate and the graduate program. Um, I have a background actually in oncology and bone marrow transplant. That was my passion and my thing for a long time. I loved working with cancer patients. I loved working with bone marrow transplant. And I worked both inpatient and outpatient. And then I just saw a huge need. I saw that there was patients that were coming back saying that, they felt like they had their bodies were in remission, but they didn't feel like psychologically they were there. And so that got me thinking more about kind of the role of mental health. And I'll be honest, I never thought I would do mental health because I hated my nursing rotation in nursing school. So I was a little bit hesitant, but I actually decided to go into the field and I absolutely love it. Another thing that kind of made me go think about the Psych and P program was also the fact that I worked in Cambodia with women that were trafficked for a while. And that really kind of sparked my interest in looking at the role of mental health. And so that's kind of where my journey was. And yeah, so I'm going to talk to you guys, and Laura's going to talk to you guys today. And I want Laura to introduce herself before we get started so that you can learn a little bit about her.
Hi, my name is Laura Agard, and I'm kind of an eclectic person at the college. I run the simulations for undergrad psych mental health. So you'll love psych mental health after you work with Sarah and I. And we'll recruit you to wanting to be psych mental health nurses in the end. So what we know, though, is that your psych is everywhere, and especially now. So my background is actually, I've done every facet of mental health. I've worked in school districts and college campuses. I have had a private practice. I have worked undergrad with our program, both in research and in teaching, with addiction specialties and communications, using something called motivational interviewing. I also work with DEs to run that for people after they practice. They get out and practice and they come back and do all kinds of something called SBIRT, screening, brief intervention, and referral to treatment, and then interprofessional education. So you may see me as an instructor in your IPE course, or you'll have me for your psych simulations. So I'm kind of an honorary nurse, they call me at the program, but my background is actually all heavily laden in every facet of psych, from, like I said, day treatment, inpatient, outpatient, aftercare, all those entities. Sarah, do you want me to just start with logistics? You're not on.
I have a slide
Great.
related to it. So if you're good, but yeah, if you want to start with it, that's fine. I can be flexible. So
okay. So Sarah's going to talk to you about some why this stress impact deployment course was implemented in the course, but I just want to talk to you about things that'll be happening. But one of the things I wanted to mention is one of the things that we've experienced with students going through this course is that things have come up for them that they weren't aware that were there for them. And, we all process in different ways. Some of us have triggers to things that we aren't aware of. I heard people say, why do I have to go to a support group? And then they ended up talking about, I thought I didn't need it. I wasn't aware. And then they went to the support group, and it was a great place to just process and to talk about, oh, wow, when I was doing this and I experienced this, or I experienced this the other day. So it was a place to talk. Within the course, there are plenty of resources for you. If you have needs, there's a whole resource content for you to use, not just during the course, during the semester, during your time at CU with us. So many entities, we want to support you, and it's been a different year. It's going to be a different next year as we go through these things. So just to create awareness in that, and a place that's safe for you to talk about it. And that's one of many things that this course will offer you as far as working with people. So, and then I am always there for you. I just ask you, give me 24 hours to get back to you, because I have my hands in like 7 different pots at the university. So sometimes it takes me some turnaround time to get through my emails. But as far as logistically, how you'll get into this course is you'll be sent a link and you will self-enroll in this course. And after you get into the course, one of the things that we're going to offer you as part of it will be doing a 1-hour support group. And those support groups are going to be offered 4 different times throughout the semester. They'll start on June 7th, and there will be 2 evening groups every week. They are going to be at 7:30. And I believe right now those are confirmed for Monday and Thursday evenings as one of the things. But when you're in the course and you go to the support group section, you will then go in and click into what group you want to be with, and then they'll send you the link for the time to participate at that. It'll be automatically generated, the course time, that the Zoom link for you to participate in the support group. And that the platform for that is a Sign Up Genius. So then at the end of this course, I will be issuing, and I'm the one that issues it, a certificate. One of the things that I'm looking for is time spent in the course, that you actually did go through the course. And then at the end of that, your final thoughts on your support group, what will be a final discussion link. And when you have completed that, I will be issuing one-offs throughout the semester, your certificate of participation for spending time with us in this course. So I'm sure lots of questions are going to come up. I will hang around, and Sarah and I will both answer questions at the end.
Excellent. Thanks, Laura. Okay, so can you all see my screen? Hopefully.
Yes.
Yes.
Okay, awesome. So, okay, a little bit about this course. This course was initially created in response to the COVID-19 pandemic, but it's intended to give you tools to respond to stressors in your future careers and create a common language that will be applicable during your time in nursing school, and also when you go into practice in your future careers. So we talk about COVID as a deployment, and this could be similar to deploying into a situation such as humanitarian aid, like when I was working in Cambodia, I worked in India and other places like that too. So those, like, you know, I knew where I was going to be and what country I was going to be in, and I knew that set of time I was going to be there. So that's kind of like a deployment, you know, working with humanitarian aid, or you can think of a military deployment. So we can broaden that term to thinking of other things as deployments. And so really, like, we can think about your nursing school and the fact that you guys are entering this time as a deployment. And so thinking of in that context, then we need to think about how we take care of ourselves before, during, and after this deployment as you guys are in nursing school. And so one of the things that I'm passionate about is really educating the next generation of nurses about burnout and about having an awareness of stress injuries, and we call it secondary trauma, the things that you could witness as a nurse, because part of that is when I was on the bone marrow transplant floor, I witnessed many friends experience stress injuries. And like I said, I worked on that oncology and bone marrow transplant floor. And I noticed that they were struggling with a lot of the different things that we witnessed in our
Jen,
oh,
where's your book?
Did someone say something? Oh, okay. So, yeah, so I just had witnessed several friends that ended up leaving not just the floor, but they left, some of them left nursing altogether. And I don't want that to happen to any of you. And I think that nursing is such a great career because you can do so many different things. And sometimes you do need to leave a floor because maybe, you know, you feel like you're needing to move on, or the fact that you've kind of witnessed that for long enough and you need to take care of yourself and move on to a different field within nursing. So anyway, all that to say is I really am passionate about this and feel like we need to build resilience in nurses so that we can keep you in the field and we can mitigate those stressors so that we can retain you in the field of nursing. So that's a little bit about kind of the passion behind this course. And I know that you're gonna see a lot from Laura McGladrey, and she's phenomenal. She has also done a lot of humanitarian aid. She works with a lot of different rescuers. And so you will absolutely love her. She is the one that does a lot of the videos in the course, and she can't be here today because she's actually educating firefighters in Wyoming, but you're going to absolutely love her. So I'm excited for you to meet her. So a couple things about the objectives. All right. So we really want to help you recognize when stress injuries occur and help you mitigate those injuries. And so we're creating a common language for recognition of occupational stress injuries, and we want to help you mitigate that. And the whole deal is that if you're aware of the stress injury, then you can respond to it in real time. And so when I talk about stress injuries, I'm really talking about, and I'm going to talk more about this, but I'm really talking about kind of trauma that you might experience in the field. And we've seen a lot of that. I'm sure that you're aware of some of the healthcare professionals that are leaving the field just because of COVID and everything that people have experienced. So really the hope is that you would be able to recognize the stress injury and implement skills early on in your careers, respond to that trauma or the stressors in real time, rather than allowing those stressors to accumulate and cause you issues later in life. Okay, so what are stress injuries? So psychological injuries or stress injuries in nursing, that happens when you see people suffering. So, you know, when I worked on the bone marrow transplant unit, we had some really difficult codes. And when a patient coded, oftentimes their platelet count was really low, and it could be very difficult to witness. And so that's where a lot of my friends ended up leaving the field because it was just too much for them. And so this course is really going to help you, again, get tools to manage those injuries. And one of the things to keep in mind is that oftentimes injuries occur when there's overwhelming stress, and it overwhelms a person's ability to be able to integrate and respond to that stress. And we call it an injury because of the neurobiology. So cortisol is released when we have a stressful situation. And that can be an acute situation or that can be a chronic situation. And cortisol being released chronically over time, that can help us survive sustained stress, but that also causes damage. And that's kind of why we refer to it as an injury. And so there's a lot of different stress injuries that can occur. Sometimes even, you might be working in nursing school and you would be working on a floor as a CNA, for example, and you may encounter different stress injuries now as you are in nursing school. And so we really want to help, you build skills and feel like we can help give you this information so that you can really be successful, not only in nursing school, but then in your future careers. Okay, dokie. So Laura is going to talk a lot about, Laura McGladrey is going to talk a lot about the stress continuum in the course. And so many people who come into nursing school might be in the orange already. So these are the different levels of stress, for example, and So green, I'm ready to go, I'm feeling good. And then you can see yellow, orange, and red. And red is when it gets to the point where like we're critically ill. And we don't want you to get there, obviously. So sometimes the stress of nursing school can push students into the orange or red. And so it's important to have an idea of where you are now and really be able to make choices to get yourself back to the green. And in the course, we're going to be referring to those a lot as green choices. And green choices mean doing things like self-care, which will help you cope with the stress. So I'm actually gonna try, I don't think I have the ability. Tammy, are we able to do breakout groups?
We hadn't planned for that, Sarah, to
Okay,
do breakout rooms with the time that we have here.
okay, I was just gonna have, it would just be about like do we have enough time for them to do like 5 minutes with breakout groups?
Amy, are you still on the line?
I am.
Can we do breakout room?
You know, I hadn't been ready for that, so I
Okay.
don't often use breakout rooms. So I don't know if Sarah, if I make you the host, can you set up the breakout rooms?
Yeah.
Okay.
Yep, I do it all the time. So
Hang on one second.
okay, so if we can get this kind of to the point where we can do breakout rooms, I want you to guys kind of talk with each other about where you're at now. And give me just 1 second. Okay. All right. All right, while I'm getting this set up, I'm wondering if anyone wants to kind of share a little bit about where they see themselves kind of coming into nursing school, if they feel like they're in the orange or if they feel like they're in the green. And again, there's no pressure, but I thought I would let you guys kind of share examples if you're willing.
I'm pretty open about my mental health. And I think I have been in the critical for the past 2 years, especially with like trying to get into the program and then how heavy our first 2 semesters were. I think it kind of burnt out a lot of people. And I mean, I've talked to a lot of other people as well, just insomnia, the anxiety, depression kind of hits us hard.
Great, thank you.
Can anybody hear me?
Mhm.
Oh, okay. So I'm coming back from a medical leave of absence. So yeah, I'm coming back in from, I think I was going into the red. So I'm excited to be back. So I'm starting now in the green and hopefully gonna keep going with that. Yeah, it's a real thing.
Yeah, it's for sure real.
I will say I'm some of everywhere, just depending on the day and time.
Yeah.
I'm also returning from a medical leave. I had some hormone issues that came up last summer and so it kind of mimicked mental health, and especially being in school kind of made it so it was impossible for me to complete the summer semester. I was definitely in the red, but after 8 months of working on getting all of that sorted out and figuring out ways to deal with mental health, I'd say I'm in green now. Hopefully we'll stay there.
Feel like I'm in the ready and reacting stage right now. After this short little break, I've done the most to try to improve my mental health and get ready for this start. But I feel like towards the end, it gets to the critical stage. So I do want to maintain it and keep it where it's at, hopefully.
I would say I'm probably in the reacting phase right now. I recently just lost my father to cancer.
Oh,
So
wow.
I was his caretaker. And so I was definitely in the red for a while. And I can see myself transitioning back down to green, but like someone else said, it kind of comes in waves.
Yeah. Thank you. Thank you guys all for sharing. I think there's so much going on in our lives, and especially as we're going into this field. I think keeping in mind, I don't catch the name of who was just speaking, but sometimes when we have that injury and personal experience of a family member that has been suffering from a disease, that can also be carried into our future careers. And so, I think that's great that you're aware of kind of where you're at and where you are on the continuum. And so I want to break you guys up into groups, and I'm going to do that right now. And when you're with your breakout groups, I'd like you to share with one person kind of what is the spark? Like, why do you want to go into nursing school? If you think of it like, kind of if you took a snapshot of right now, why do you want to go into nursing school? What is charging your battery about going into nursing school? And then where are you on this continuum? Some of you have already shared that. And what's draining your battery? And I can also put this in the chat too. And then what practices can you set up now to kind of make some green choices to get you back to the green? So those can be self-care things. So we're going to talk about, again, where are you on the continuum, and why do you want to go into nursing school? What's charging your battery? And then what's draining your battery? Any questions? Okay, I created the breakout rooms. So you're gonna have a group, and again, I'm just gonna give you about 10 minutes so that we're back here. And so again, if faculty end up in a group, if you'll just take yourself out of that group, you can come back to the main group, okay? And you're gonna get a notification when I open the rooms. Thank you all for participating. If you want to mute yourselves again, just so there's not an echo. So is there anybody that's willing to share a little bit about what their green choices are going to be to get through nursing school?
I can share.
Okay, great.
So I moved from Portland, Oregon to Denver for school for this program. And it's the first time that I've ever been away from my family. My family and I are very close. And so one of the things I discussed doing to stay in the ready section was to make an active choice to make time to talk to them and FaceTime them and just keep them in my life and remind me that I can do hard things and that I have a strong support system, even though they're not physically here with me.
Excellent. That's a great practice to have. Thank you for sharing. So I appreciate that. And I think, as you guys go into the course, this is like a very quick view of what the course is going to be like. And I think you'll really enjoy this course, and it's going to really set you up for success, not only in nursing school, but in your future careers. And I'll be honest, I wish I had a class like this, and I wish my friends did that ended up leaving the field of nursing. And so I am excited for you guys to be in this course. I think you'll really enjoy it. Again, I can also post the logistics that Laura already talked about in the course, but part of it is that you will do a support group. And just remember that the support groups are limited to 6 students per group. And so there's going to be multiple days during the week that you can sign up for a course. There's 4 different dates. So, and just keep that in mind. And Laura already talked about accessing the support groups and whatnot. So if you have further questions, feel free to reach out to us. And I just wanted to end on a note saying, that really, you could blow through this course in a few hours, or you could take time to go through the course and really learn to recognize and mitigate the injuries, the stress injuries. And those stress injuries can result in not only psychological, but physical manifestations. If we look a lot at, if we look at nursing, we look at health in general, a lot of the population in America has stress injuries and physical manifestations of that, so thinking about that in terms of what do we see in our population now, and how much of the physical ailments are we seeing that are a result from actual psychological stress. So it's something important to be aware of. And I'm really excited for you guys to be able to have this opportunity. I'm excited to be here. I'm excited to just be able, I just feel like it's an honor to be able to work with nursing students. And I know that you guys get stressed and it can be a stressful time. And so I really want to support you through your careers. Hopefully I will see you in mental health. I teach in the undergrad program, and then I also teach in the grad program, as I mentioned. So maybe I'll see a couple of you in the Psych NP program if you decide that's your passion. So it's a great field. And yeah, I'm always happy to support you. Laura Agard is here to support you as well. And if there's any other questions, I want to give time to that.
Sarah, can I add one thing?
Yeah.
So I just wanted to talk about real quick your green choices. And I just, I think that people come up with wonderful things like, I'm going to go have lunch now. I'm going to eat a good healthy meal. I'm going to take a 5-mile run or ride my bike or do those things. But green choices are also taking care of yourself in the moment. A green choice, it may be lighting a candle in the morning. A green choice might be, going to the bathroom when you have to go. It's notorious that nurses have really bad bladders. And so, ask somebody to cover you and just go to the bathroom when you need to go. Those are all things that are self-care that we kind of don't think about self-care. Make that hot cup of tea before you start, studying. Set your alarm and take a lap around your house every hour or something like that. So those are all extra green choices that we don't necessarily think about that keep us going through rather than getting someplace to make a green choice.
Yeah, thanks, Laura. Appreciate that.
And then somebody asked, you will be sent a link to self-enroll in the class. And what was the other question, Sarah?
There is a question about, from Shannon, how long should we plan to set aside to spend in this course to get the most out of it?
Probably a total of 8 hours plus your hour in your support group.
Awesome. Emily asks, will this course factor into one of our semesters or be taken on our own time? When will we take it?
So you'll take it this next semester as part of your semester work.
Perfect. Is this one of our required courses?
Yes, it is.
I'm sorry, it's during summer, right? You mean?
No, well, yes, during the summer.
During the summer, okay.
And it's not a required course in terms of your program plan. But we're requiring our students to finish this course because we really feel it's that important for students to have this information for your own mental health and well-being. Any other questions for Sarah?
I'd like to ask, is it online or it's going to be in person, this course?
It's all online, including your support group will also be online.
Thank you.
Mm-hmm. And there's a lot of videos. So Laura McGladgery also has an organization called Responder Strong. And so you'll see some of the videos that she has created for first responders. And so you'll see a variety of videos from Laura. And again, I think you're going to love the videos because she also works with a really well-known psychiatrist, and Steve Berkeritz, he's also on a lot of the videos. So I think you're really going to enjoy all that you have to learn. And Laura goes around the country and speaks. And so you're going to get an opportunity to learn from her and also Steve Berkowitz as well. So it's a really awesome opportunity.
Any other questions for Sarah or Laura? Now's the time.
Does your
Gabriel,
support group sound the same is your support group always the same people? So you sign up with this 6 people and you're with them the whole time?
No, your support group is only 1 hour, one time. If there was an open space and you wanted to go again, I suppose you could do that, but your requirement is only to go to one time, and they'll have kind of different umbrella topics on that you can pick from.
and Gabriel asks if the support group is mandatory.
It is to be certified in the class, yes. And it's just an hour. 1 hour, one time. That's what the requirement is.
Yes. Sonia asks, will the course be available by next week so we could start during orientation?
Yes.
Yeah, and support groups will be available starting June 7th.
What should we expect these modules to be titled?
I'm sorry?
What should we expect them to be titled under modules?
Each
the course.
Yeah, each so I'm not sure what your question is actually.
So I know there's a course we need to complete. I was just wondering what it would be titled for us to be able to find it.
Oh, it'll be sent in a separate link with the enrollment link, and then you'll just click on that link and put yourself into the course.
Thank you.
And Emily asked, will there be reminders for us to take the course, or should we take note of it and remember to sign up later?
You should take note of it. You probably should sign up as soon as you get your link and, move through the semester or get it done right up front, whatever meets your need in that. I realize people are also juggling clinical experiences and some of your work experiences as well.
Will there be graded assignments for the required stress course?
There is not graded assignments. There are discussion posts, and I will be monitoring, like I said, your time spent in the course and just that you're participating.
Miranda, are you required to go to support group once a week?
Only one time.
One time total.
One time for 1 hour.
Mm-hmm. Matthew, will this link be sent to us via our school email?
Yes.
Link going to be sent via so the link will be sent to you in an email. You'll click on that link, you'll self-enroll and take it away.
I just posted in the chat some of the information. So if you want to copy that information, then you can paste it somewhere in a document.
That might also, Sarah and Laura, be handy to send with the email with the link in it. Just some of these FAQs, there's a lot of information we're going to present to students today.
I'll do that.
Yes.
Perfect.
Yep.
All right.
Tammy, I made you host. So Did you see that? Are you the host now? Can you verify?
Yes.
Okay.
Thank you, Sarah and Laura.
Thank you so much, Sarah and Laura.
Of course. Thank you. Thanks for having us.
You bet.
Thank you.
Bye.
Okay. Thank you so much, everybody, for your engagement with that. And please let us know if you have any questions. We have LA. Hi, LA. Who's going to talk to us about less stress and more success. And LA is the director of Learning Resources Center at the CU Denver campus, and her expertise is around learning and how to make your organizational efforts be the most awesome ever, so you can really focus on your learning and getting more out of your learning. So, LA, without further ado.
Good morning, folks. Delighted to be here today. And I want to share first, I volunteered to be a part of this because I really admire the dedication of the faculty and staff in your department who are focused on making sure that every student who starts this program can finish this program. And so we're going to talk a little bit more on some strategies that you can utilize as you start your nursing program. And we can also talk about the importance of why we even spend time on this. So for the first part, I always like to talk to folks about how their learning is being connected so that you're able to, as you go through this morning and throughout the rest of your week, you start to see why they're asking you to do the things on Canvas, why they're talking about stress and building community with support groups, why we're going to spend time on organization and time management, and then also why we're going to talk more about cognitive retrieval. And so just to start, every person who's going through a major life change, and already today, some people mentioned experience loss, adjusting to work challenges, relocating and moving to start this program. So all of these things are major life transitions. And anytime you have something like that, it's occupying space in your brain. And it equals a little bit of dissonance, a little bit of emotional, mental, physical dissonance before your performance really starts to gel. And another reason we spend time talking about this is learning engagement. When students feel connected, that they're part of a community, it often translates that it's easier for them to learn and they feel more engaged with the learning. And in building that community, you also then have folks that you can practice with. You can develop study groups and things like that. And so as you're meeting your classmates and you're forming study groups, this is going to help improve your learning recall. With organization, the more organized you are, the more that you're putting things outside of your working memory and you have it set up and structured, the more learning capacity you will have. And so the interesting thing about our brains is we have a limited working memory. And until things move into that deeper file cabinet, it reaches its full capacity and you can't have space for anything more. And we're going to talk a little bit more some of the things that happen when you reach that. With priorities and goals, when we look at if you have the ability to prioritize and you know your goals, it often leads to more effective time management. And then the time that you spent knowing how to learn, it's really the concept of metacognition, what we learn about learning, what we think about thinking. And so the time that you spend doing that can increase your learning performance. And just one example is the time you spend dissecting an exam after you get it back or a quiz after you get it back. Where did you excel? Where could you grow? Where could you alter your study strategies? That's all part of metacognition, and that can improve learning performance. And in a whole, all of this leads to stronger emotional and mental health and increases your cognitive capacity. And really what I want for every student is less time studying, more time to enjoy life because you're learning the most effectively possible. So let's talk a little bit more about what goes on. Sorry, I'm having trouble changing pages. What goes on? Okay, so the first thing to think about is learning is an extremely messy process. What happens for a lot of folks is whatever stage they're in, they get to the top of that stage. They're really good at doing it, whether it's a job you've been in for a couple years, an academic program that you've been doing. You've gotten really good at that. And now you're moving and jumping to a new area. You're rebuilding that foundation. It's almost like you're building a new house and you're laying the cement floor. It is going to take a while to build that foundation, and it may take you longer to learn things and know things. And I often remind folks, especially when starting a new academic program, remember how it was to ride a bike or learn a sport, whether it play an instrument, all of those things. You were not excellent at the beginning. It took some trial and error. It took some messiness. It took some evaluating your performance and learning where you needed to strengthen it that helped you really become strong in that area. And so just keep that in mind. Learning is a very messy process. So transition is fascinating, the way it affects us in so many different dimensions. And so when someone is experiencing a major life transition, it can show up with physical exhaustion. And so we see that some people may sleep a lot more. They may find themselves tired because when you're actually learning new things or dealing with things, your brain is burning more energy. And so you may be more tired and also more hungry. And some folks may find themselves sleeping less. They're sleeping 4 or 5 hours a night. And so just keeping that in mind of how your body is impacted physically with transition. And then we have time management. Because your working memory might be filled to capacity, you may be forgetting small details if you don't have a system that's organized. You could miss classes or appointments, show up at the wrong time, forget something. This is all very normal in dealing with transitions, and your organization system will help you avoid these. With emotional stress, people will find themselves feeling different moods and different behaviors in the way this is expressed. And that is all quite part of this process. A lot of folks in transitions will have challenges with decision makings. And that means because your working memory is so full, you might have difficulty seeing the options. And this is where it really helps to talk out loud to somebody what you're dealing with and help them bounce the ideas of the specific steps you need to take. And finally, with memory capacity, again, working memory is full. If you have ever had a big major life change and you find yourself losing your keys, misplacing your wallet, can't find your cell phone, put your coffee cup on the top of your car and drive off. These are all examples of your brain is full, little things are slipping, and it just takes time to put those things into short-term and long-term memory. So a lot of times when we're experiencing stress, especially when starting a new academic program, it can feel like the lack of time. And oftentimes it really comes down to time management. But I would love to hear, because you're very full, whole beings, what are some of the things that you all are stressed about with your time? And just put that in the chat box. Let's just share and see how many things we have in common. What are some of the things you're stressed about with time for this summer? Not enough time in a day. Work, school, not having time, kids. Kids will take a lot. Deadlines, trying to find time for physical activity. Oh my gosh, 3 kids home for the summer. Giving enough time to family, friends, everything. Potty training a toddler. Yes, all of these things. Time to sleep, spending time with those that you care about, and managing your own mental health. I love this, and I encourage all of you, look at this list. Look that you're not alone. You're not the only one balancing it. And this is all very normal and to be expected. And in fact, there will not be enough time in a day to do often everything that you're asked to do. And so it's really about how we're prioritizing what is the most important thing for us to tackle. So I like to break down with folks of, let's even see where we're at. Let's see how many hours we have in a week. So if you take a standard week, we have 24 hours times 7 days. We're starting off with 168 hours in a week. And then we think about how many hours do we need to sleep. I have a sister who needs 10 hours. I sleep 5 hours. Everybody has a different thing that there's a difference, I think, between what we get and what we want. But start with that. So in this example, we're starting with 8 hours over 7 days. That's 56 hours. And if we take that away, we're left with 112 hours. And then we look about how many hours do you spend eating and getting ready? Let's say that's 3 hours of, prep time for yourself, taking care of yourself, showering or fixing food, And that can be more if you have others also depending on you. So 3 hours times 7 days is 21 hours a week. So now we are left with 91 hours. And then how many hours are you in class? Let's just use 15 as a standard. We're left with 76 hours. And then what else to do in your week? Are you, working, studying, taking care of family, taking care of parents or children? All that adds up. And so we'll talk a little bit more about how much time you should spend studying, but let's just say you spend 30 hours a week. Now you're left with 46 hours to do all those priorities that you have. And so it's really good to see what do you have left on the table and how can we divide that up so it's the most effective. Okay, so one of the things I always like to ask, and if you can put in the chat if you've heard this, a lot of times in orientation, they will tell students for every hour you're in class, you should be studying 3 hours outside of class. Just put a yes if you've ever heard people say this. Yes. And I'm going to tell you, it's very well intentioned when people say this. What they're doing is they're actually taking an average, but that number's not correct. So what happens to folks, and I can see by all of you saying yes, what happens to folks is then they have an hour of class and they don't spend 3 hours. Some people spend 6 hours, some people spend 1 hour, and then they stop believing that and they don't use any figure then to calculate their time. The truth of it is the study time will vary because your level of experience with that subject varies. So if I have a student who has a lot of experience in math, they were part of math club when they were in high school. They have always enjoyed numbers, and so they do it in their spare time. They take AP classes. They are up to Calc 2. They will take less time in Calc 3 than a student who is maybe coming in into Calc 1 and hasn't had that time and exposure with math. So your knowledge level and how you're building that cognitive framework will actually impact how much time you have to spend. And so what I tell folks is the first week or two of class, take an assessment. When you're looking at the syllabus and you're evaluating how familiar the topics are, flip through the book, the first lecture, listen in, and start to gauge the amount of time you might need. You might have classes that you have more experience in, medical terminology that you know, and you may need to spend less time there, but more time in an area that's new. So be sure to vary it according to what that class needs. And while you can use the hours for every hour in class, that's not a hard and stand fast figure. It's way more flexible. So find the time for you. Here's the other thing. Oftentimes we look to our left and we look to our right and we see what other people are doing, and it can shake our confidence that we feel in our own academic performance because we see people maybe spending less time or more time. And we begin to wonder, am I spending enough? And what I will say is it's very individual. When I sit down with students and I do coaching with them, we figure out what works for them. So while you may gain inspiration and motivation from your classmates, don't let it shake what you need and make you question your own academic efficacy. And so now I'm going to switch gears a little bit and talk about self-management. And I love Jim from the office, and he's when they ask me how I study in nursing school, we've got a big percentage procrastination and distracting others, and we know that's not true. This is just to be funny. A lot of nursing students are very dedicated and they focus on trying to give the time they need. And you will be asked to give more at the beginning when you're learning those foundational things. And so let's talk about some things we can do that will help you avoid any distractions and procrastination. And so it begins with the mindset. It begins with setting a mindset that is growth oriented. And I tell students, when you are experiencing challenge, you're not performing the way you'd like in something, instead of saying, I'm not good in chemistry, dwell in the possibility of yet. I am not good in chemistry yet. because learning is simply electrical impulses between synapses. And when you break it down like that, we all have the capacity to learn anything. It's how much time and energy and attention can we devote to learning that subject. And so when you're experiencing hardship, repeat to yourself, I'm not good at this just yet, but I can be. A second part of that that goes right along with growth oriented is self-advocacy. And this is you taking charge of creating your own experience. The challenges that you're facing, like you have made it to this point because many of you are strong self-advocates. You ask for help when you need it. You ask for clarification. If you are challenged in learning something, you go to get tutoring. You go to talk to a peer mentor. You reach out to the care team. This is all part of advocating for yourself to make this learning experience what it needs to be for you. And then that part of that self-advocacy is what are you doing to contribute to it? And so as much as you're creating your own experience and dwelling in possibility, you're taking control of your learning, that you can control your own self-regulation and how you tackle your learning. And doing all of these creates a mindset where possibility can occur. And in doing these, every one of you has the capacity to graduate. This program could be at 100% graduation. If everyone, as they're going through it and they want to be a nurse, they can be a nurse. So motivation. What do I need to grow to motivate myself? And before I share a little bit more, if folks can put in the chat box, what do you use for motivation? Okay, you're in this program. What are you using for motivation to graduate this program? Your future. Your kids. Yes, becoming a nurse, past experience. I love kids. Seeing myself on the unit, my future. Different career opportunities, future patients. Oh, stability, goals, knowing my kids are watching me. My kids, your kids are very important. Goals of becoming a nurse, opportunities, family, friends, my music, fulfilling career, role modeling for others, future patients. I wish we could just capture this and keep it so that when you're experiencing challenges, you can remind yourself of the things that motivate you. And I tell folks, really looking at your commitment, what is the effort it takes, your connections, what are those relationships you have? And many of you mentioned those relationships, and even the curiosity, the excitement you have for learning. As you're diving in, you're answering the questions that you've always had about the nursing profession and what you've wanted to see behind the scenes. You're getting to peel that back. So as you go forward and you're thinking about your motivations, taking some time to write down what are your commitments, the effort that you're going to take in motivating yourself to complete this program? What are the connections which are sustaining you and motivating you? And what is it about the excitement of learning and the curiosity that really is going to propel you forward? Oh, I love this. The idea of helping and caring for as many people as I can and helping to provide for my family while doing something I love that's rewarding. And I encourage all of you, write these statements down now and use this orientation time to capture those things. So we talked about the mindset that you need. And we talked about, just the things that drive your commitment. And now's my favorite. What are the things that suck up our time? And I want to hear from you all. What are the things that suck up your time? What would you consider time wasting culprits? Social media. I bet you that will be our number one. Social media, my phone, TikTok. I just have to share with you all Instagram Reels. I am so sad I discovered this. It is taking my time. Anything with the screen, my dog, Netflix. Yes. Kids definitely. Books. Yes. Shopping. shopping in person, shopping online, all of this. We have a lot of things that are pulling our attention, and some of these aren't as productive to our goals as we would want. So let's look at some of the top 5 time wasting culprits. 1, technology interruptions. Oh, I even like that people are throwing in procrastination and perfectionism. So technology interruptions, social media, the things that are unplanned that take our time away and are not contributing to us being productive. And while they're good for a little bit of escapism, a little bit of entertainment, and a little bit of connection with others, when that time isn't measured and isn't captured, it can just take over and take all our study time or take our time away from our family, our friends, our priorities that are important to us. And so really capturing, how is technology interrupting your time and how much time is it taking? Folks also report unplanned schedules. So these can be things that are emergency surprise or things that just weren't accounted for, of, not realizing that driving children to different lessons could take time away from studying and counting that up. Or at the last minute, your partner asks you to do something, and then that's been something that wasn't planned in your schedule that's now taking you on a detour. Or my favorite, a pipe bursts. The roof is leaking. You have those unplanned things. And so those can be time wasting culprits in the sense of you weren't planning for them. Inefficient delegation. This can be within a family unit. This can be within a work environment. This can be with academic projects, things like that. Not being able to delegate effectively and efficiently so that everyone is carrying the weight, and sometimes people taking on too much for just themselves. And that combines with lack of prioritization. And you don't have to respond in the chat, but just nod to yourself. If you've ever experienced that you have 10 things to do and you end up doing the one thing and spending the time on it that just wasn't the most important, and you realize it afterwards and you say, why did I spend all the time organizing my closet when that wasn't the most important thing I had to do? Sometimes it's great escapism. Sometimes it's great to let the mind wander. Sometimes when you have a big exam the next day, it's not the time to clean your house. And then the final is multitasking. As much as, and I'm guilty of it too. I'll be in a meeting. I'll be trying to do something else. As much as we think we're good at multitasking, research study after research study has shown we actually suck at it. We are not good at multitasking. We end up lowering what we're doing in each area. And my favorite is when I have a really good friend who she is convinced that despite all the research, she is the exception to the rule and she is great at multitasking. And I enjoy testing her and asking her questions when we're talking and she's multitasking, just to see how much is slipping by her. And there is a lot. So as much as we think we're really good, the voting time when we sit down to study, it is better to study in smaller blocks and be really intense about it than to spend a long time in trying to do multiple things at the same time. So if you have any other time wasting culprits that weren't caught, yeah, and I didn't include kids in there, just keep that in mind. So something that folks find really helpful is looking at how we make decisions about our priorities. And there's this really neat grid. It's called the Eisenhower Matrix, after President Eisenhower, who had a military background and utilized it with helping to develop priorities in planning and project management. And so it begins with 4 quadrants, and it has things that are not important and things that are important along one axis, and along the horizontal axis, you've got what's urgent and what's not urgent. And so if we look, the things that really are must do are the do number 1 category that are urgent and important. And then the things that are important but not necessarily urgent. You have a big exam coming up and it's going to be important, but it isn't urgent on June 7th. you're going to want to plan and take the steps to break that down so it's not left all at the end. And then looking at what is urgent but really not important. And I will say family members do a lot of this with us. They say things are very urgent, but they're not really important. And so this is where we delegate or we put a pause on and things like that. And then we discover that there are commitments and things pulling us that are not urgent and not important. And these are the things that we eliminate, learn to let go, learn to say no to. And so what I encourage you to do is the first month, really use June as an opportunity to start to go through things and prioritize them on what needs to be, now that you're in the nursing program, what needs to move to urgent and important, and what could be eliminated. And then also looking at the other categories, but really letting go some of those things that can be eliminated. And let me know in the chat box if you have any questions about this decision-making matrix. So considerations. As you're going through and you're trying to develop an organizational system, a time management, a priority system, these are some important things to consider. Somebody nailed it exactly. Thank you, Jamie. Isn't this how we end up deprioritizing self-care? And that's where self-care needs to be in that number one quadrant, because your ability to care for self will allow you to sustain all those other priorities and continue in your program. But if that one gets put in the eliminate, it will be the one that causes all the other systems to fall apart. So thank you, Jamie, for bringing that up. With considerations, think about, how do you track time? What system do you create, and how are you measuring the time and breaking it up that works for you? And then your list making. How are you capturing the things on your plate? So if you think about everything you have to do as a plate, how are you capturing those things? How are you prioritizing them? And then how are you checking off the progress you're making with them so that you can monitor that? And then the final thing is goal setting. How are you setting those overall goals? What are the small tasks that make up the goals and the actions that you have to take? And then what reminders do you put in place? And I will say, with all of this, how do you set up a system of accountability that you make sure that you're making progress and getting things done? So a system I like to introduce is the Cornell Time Management System. And you'll be sent out this presentation. And so you'll be able to look up some of the links that I'm going to share in the next couple slides. But Cornell Time Management, and this is Cornell University, they have a great time management that they've developed and they've shared. And this entails three things. You look at the big picture of the whole semester, and that lets you see where you need to start breaking up tasks so that you can be sure to get them done. And then you look at the weekly. What do you need to do in that week? What needs to maybe move from different days to other days where you have time to do it? How do you divide up your whole week? And then there's the daily to do. And this can sound complicated, but it's really the three frameworks in which you see, what do I need to do today? What do I need to do this week? What does my semester, my summer semester in this program look like? And that can really help. So Cornell Time Management, if you visit that webpage, they have some different sample calendars. You can look a little bit more in depth about the information they have. But even if you keep the framework in your head and you don't use any of these tools, what do I need to do today, this week, this semester? And so after you think about those different systems, how are you keeping track of that time? We've talked about how you prioritize. We've talked about looking at time in three different perspectives. Now I want to talk about your study group time. And this is part of that time management. Study after study has shown that us as humans, we have an attention span that goes, well, our attention span can be even shorter, but when we really focus, we have between 30 minutes and at the most 120 minutes in which we can devote time. And somewhere around that, you need to get up and do something different. You need to take a break. Your brain starts to wander. And I tell folks, if you've ever driven from one place to another and gotten there and not remembered driving, that's an example of your brain being on autopilot. And what your brain is actually doing is it's evaluating at a moment. Do I need to pay attention? Is this essential for my survival? If it's not, it starts to wander. It starts to use less energy focusing on the task. And so when we sit down for a 5-hour marathon study session and we start to read the same page over and over, and we're like, wait, what was I doing? Those are examples of your mind getting that hypnotized and starting to wander. And that's when you need to pause. It will be way more effective to stop what you're doing, get up, walk around the room, come back 2 minutes later, or do a task, wash some dishes and come back, and then refocus. That is far more effective than staying there and trying to force yourself to repay attention, because your brain needs to have something to shake it up. And then you come back and you tell it, okay, now we're going to pay attention. So we tell folks the Pomodoro method. It's a method of 25-minute blocks. So for 20 minutes, you study intensely, and then you take a 5-minute break, and then you shift to something else. It could be a different topic. It could be another chapter. It could be a different type of problem. And so we tell folks these small chunks that you do something and you switch it up to something else, and then you maybe even come back to what you were first studying. Folks will report that it feels less effective than sitting down and focusing on one thing and going through it for several hours. But research has shown that when people are tested afterwards, they actually retain it better. So even though it doesn't feel the most effective, it is the most effective. So think about breaking things into half an hour, 45-minute, 25-minute chunks, doing a small break, getting your mind to shake it up, then coming back to it, mixing up the topics that you're doing. And the most important thing is don't waste those little chunks of time. I will talk with students and they'll say, well, I have this break between my classes and it's only 45 minutes, so it's not really time to dig into anything. And I say, actually, that is the best time. That is the best time to start to get those small chunks in. And so that you can utilize those chunks, in between cooking something for dinner or picking up children from school. Those times waiting can actually be really effective. So be sure not to waste those times. And again, just sharing some resources, this website that has some different planners. This is another example of planners of people figuring out what they need for them. Some people will like to capture what they did last week, what they need to do next week, what is going on this week, important priorities, doing an end of the day review, noting different tasks or errands they have to run, bills that are due throughout that month, whatever works for you in capturing the things that are important in your life. And because we have over 170 people here, I would say we probably have 170 different ways to organize time. And people will ask me, well, what's the best method? And it's almost like that thing with exercise when what's the best time to exercise during the day? And doctors will report and nurses will report and medical personnel will report. It's just exercising and getting that done. Well, as a learning specialist, I'm going to give you the same answer. It's a system that you actually use. So figuring out the system that works for you can be, that's the answer to what is the best system. And some folks really like technology. Some folks will really like paper. Some folks will like whiteboards that they can put up and have a visual. And so this Life Hack article has some different apps that people use. Some of them lock down your social media until you've accomplished the tasks that you need. Some of them monitor what you're spending time on your phone or your iPad or your computer and can give you information back that helps you maybe reprioritize. Some of them help you list your priorities. Some help you keep progress that you're making with things, and some help you map out the time in how you're going to divide up that project management. And so I would love if any of you are using a paper calendar or a app with your technology, feel free to share with each other right now in the chat. What is useful for you? What have you seen that's really cool that others should check out? With some good recommendations going in. And I encourage you all to look through those and keep sharing with each other, because wisdom is often generated. And this group has such incredible perspectives and wisdom that together you can generate a lot of answers and a lot of possible solutions. And so again, going back to organization, what works for you and finding that system. And the most important thing, again, a system that you're actually going to use. So my recap of some of the important things I hope you walk away from this session with is build your support squad. Use this time to meet people, orientation, summer, to start to assemble study groups. And oftentimes the most effective study groups could be between 3 and 6 people. And you may be involved in multiple study groups. And that's great because you hear different perspectives. People have different ways of presenting information. Even if you're really good at something, teaching someone else makes that learning get reinforced in your brain, and it can actually help you do even better. So every support group with people of every level is important. And then being sure to ask and reach out for support, to advocate for yourself and also regulate your own learning. And then with knowing your goals, reminding yourself why you're here, how important it is that you wanted to do this. You've been working so hard to do it. Now comes the next stage of doing it. And so identifying your goals and your priorities under those goals, thinking about the study strategies that you utilize, and then creating an individualized system that works for you. And so I've thrown out a lot of stuff, and you all have shared a lot of really great ideas. What questions do you all have for me? And feel free to unmute and ask, or you can put it in the chat.
I actually have a funny question. I read somewhere that like taking intermittent naps after your study sessions like help with your recall. Have you heard anything like that? Because I tried to do it, but I felt like me laying down made me anxious, and I was like, I'm wasting time taking naps. But I also read a lot of stuff saying that it helped.
That's the funny. And some folks will really report that a little cat nap, taking a 25-minute nap, a half an hour nap throughout the day will give them energy they need. But I haven't really heard recommendations of more than one of those in a day. I will say that in visiting the Edison house, Thomas Edison in Florida, he used to have a cot that he would sleep at, and he would do a little bit of lab work and then lay down for a nap and then get back up and work. And he didn't sleep a normal sleep habit. Now, he was pretty brilliant, but I would say for the rest of us that it's more switching up your brain. And so probably an even more effective strategy is just doing something else, pausing for a moment to get your brain awake again, and then coming back to it. That's probably even more effective than the cat nap. A great question. And it worked for Edison, so I can't say it doesn't work for a human out there.
I think that's also what I heard too, is that it helps with like creativity. So if you're in like a writing block, obviously like if you don't know what you're writing about and you can't find words to just, toss it to the side. But then they also recommended taking like a nap and then going back to it. And they said even like drink coffee before your nap. So whenever you wake up, you're really wired and your brain's fresh to go. It was interesting. I just couldn't do it. I really tried. And I was like, I think if I could do this and if it works, it'll work for me because I love naps, but I just couldn't do it.
I can attest that does, for me, I'm 44, and a cup of coffee or something with caffeine and then setting my timer for a 15 or 20-minute nap, or like 25 minutes so that you have like 5 minutes to sort of see if you can actually take the nap. And then if you fall asleep, I'll usually wake up within 15 or 20 minutes on my own. But that is like the best rejuvenating thing for body and mind for me at my age, at least right now. So I highly recommend that little caffeine and then a very short cat nap, it's like a miracle.
And this is awesome. Use the month of June to say, I'm going to figure out what works for me. And the one thing I will say is if it doesn't work for you, switch it up. Try something else, because I will see people spending a lot of the time trying to get one method down and they think that's the only way. And there's so many different ways of doing it. I do like coffee naps. This is amazing. I had never heard of coffee naps, but now I will try it. Other questions? These are great. Coffee naps changed my life. Okay, I feel like my life, you all are witness, my life has just changed. Anything else?
LA, I
Any
just
other
want to take a moment
secrets?
and say thank you so much for everything you've done to help support our program. We just cannot thank you enough.
Well, I really appreciate all of you and the path that you're taking and the way that you're going to serve others. It's just so important. And the biggest thing is there is no reason that there isn't a 100% graduation rate. There really isn't. It's just electrical impulses. And if we support each other and you spend the time and the energy and dedication and ask for help, we can all, well, I can see each of you soon at graduation.
Thank you, LA. And I would just chime in to take it to the next level. That's what nursing is all about, is supporting each other and being a part of the team. And if you're a part of the team, everybody works together, you're all successful. So thank you so much, LA.
You're welcome.
Awesome. All right, so we are going to take a little bit of a break and let's come back at 10 o'clock. I believe Amy is when we're back.
Yeah, we'll come back with our next presenter, which she's going to be talking about how to make learning stick and cognitive retrieval. So we'll see you all back at 10 o'clock. Thanks, everybody. Thanks again, LA.
Oh, you're welcome. I'm reading all the suggestions people have.
Yeah, I was direct messaging Tammy earlier saying that I'm going to try to save the chat. I'm going to pause the recording right now.
What other?
I just started recording again for the student who asked me to record. Thanks, Katrina.
Yeah.
Tammy, there was a question about, is health assessment listed as 2 courses in their schedule?
So on the schedule that's posted on the main College of Nursing website, you'll see blue and purple group, and then you'll see green and orange group. Because one of them is on Monday and one of them is on Wednesday. I think that's what the question is.
Perfect.
Yeah, so it did say that it was in person. So I had scheduled on every Wednesday in June to be on campus from 8 to noon, but that's not the case. We're going to be all remote.
Right. All of our summer semester is remote.
Okay.
All of our courses.
The one shift you were talking about.
Yeah, all the summer courses are remote. Patho is remote, health assessment's remote, your roles course is remote. So they're all remote. Now, having said that, Amanda, you will have synchronous class times.
Okay.
So in other words, you will be expected to be in class. It's just the in class is going to be on Zoom.
Perfect.
And we're going to be expected to be on Zoom from 8 a.m. to 12 p.m. on Wednesday,
so what?
Whatever.
So great question. Yeah, great question, Jasmine. What I've done is, and the syllabus will hopefully be posted by next week. I'm shooting for June 1st for that to be posted, but because of the large class size, okay, instead of having 90 students on Zoom on Monday and 90 students on Zoom on Wednesday, what I've done is I've broken it in half. So I've taken that group of 90 on Monday and I've broken it into 2 groups. So one group will go from 8 to 10, the other group will go from 10 to 12. And same thing will happen on Wednesday, because it's much more manageable on Zoom to have, a group of 40 to 45 students than it is to have 90 students on Zoom. So that will be when the syllabus is posted, you'll see, blue group meets, I can't remember off the top of my head, honestly, but blue group meets Monday from 8 to 10. Purple group meets Monday from 10 to 12. Orange group meets Wednesday from 8 to 10. Green group meets on Wednesday from 10 to 12. Don't quote me on that.
We'll
That's
be
the
with
way
our
we do it
color
now.
group.
Say again, Jasmine?
We'll still be with our color group. It's not like
Yes.
you're gonna, okay.
Yes. Yeah, you'll be with your color group. But the point is that I learned pretty quickly last summer when we did this remote that having 90 students on Zoom at once is frustrating for faculty and it's frustrating for students. So smaller groups work much better than that.
Sorry, I have one more question on that.
Yeah.
Do you know if our patho is going to be like that? Because I know that that's also a 4-hour block.
Mm-hmm.
So I wasn't sure if we're going to be on there for 4 hours or not.
I don't know that for sure, Jasmine, but again, they should be posting their syllabus soon as well.
And I see that Alexis, our next speaker, has just joined us. And I wonder if, I know there's still some questions in the chat. I wonder if we can either answer those in the chat or if we can answer those at our next break, maybe?
Yeah, I think we can circle back to them at the end. I think we'll have time for that, Dr. Stevens. So yeah, I wanted to, it's a good segue to welcome Alexis. Thank you so much. So Alexis, thanks for being here this morning. Alexis is an instructional designer with the Office of Digital Education with CU. And as I mentioned earlier, she's going to be talking about how to make learning stick and cognitive retrieval. So thank you so much, Alexis. I'll let you take it away.
Alexis, you're muted.
I know. I was trying to share my screen, and at the same time, everything disappeared. I'm like, where's my unmute button? Can you hear me? Oops.
Yeah,
maybe
we
not.
can.
Yes. Oh, good. Okay. Yes. And can you see my... Actually, I think I just unshared it. Let me now properly share. I think that's what you need to see. So you've got a PowerPoint presentation and you've got me, hopefully.
Yes, we're ready to go.
Yes. Looks good, Alexis.
Thank you. It's always that awkward little setup when you first start on Zoom. And as Carmen was saying, I'm an instructional designer, which means I know very little about nursing and I can't answer any questions about heart attacks, etc. But I do know a lot about learning and about education, and that's why I'm here. So a lot of times we work as instructional designers with online learning specifically, but that's not all that we do. We know a lot about how the brain works and how it functions, and we partner with different subject matter experts to help you best learn information. So no matter how great your professors are, learning is hard work and it takes effort on both sides. And so that's where we want to make you empowered and give you some tricks and tools for engaging with your course content in meaningful ways that will actually help you remember it. So I do a flip side of this presentations for faculty, which is basically, we know your lecture is brilliant, but students aren't going to remember it. Just telling students information doesn't make it stick in your brain, which we know is the goal for all of us. So what I want to start off with is asking you, each of you here, to write down everything that you remember hearing from this morning's presentations or meetings so far. Doesn't matter how important it is, just write down everything that you actually remember. And I know you might be inclined, like you're just gonna sit and think about it, but I actually want you to write it down, and I'm gonna give you a full 5 minutes to do this. So it might be easy at first, but it'll get a little harder. So push yourself to take these 5 minutes to write down everything you remember from the last 2 hours, basically. And if you've been taking lots of notes, try not to look at your notes. Just go from memory.
Gosh.
Take about another minute and keep thinking about what you remember from today's meeting. So it's been about 5 minutes now, and hopefully you can hear me. Does anyone want to share what the experience was like? Did you find it easy to spend 5 minutes thinking about everything that you've heard so far?
It was very hard not to look at my notes.
Definitely. We rely on these tricks. We write it down. We figure, great, it's all here. I can go back to it later, and it's like I'm back in the lecture. No big deal. And there's definitely a reason why it's harder from memory. And that's actually what we want. We want that effort. We want that effortful recall that we call it.
I
And
found
like
that I
what-
was writing down the same thing in different ways, I guess. Like I really whatever I retained or what stuck with me really stuck with me, and I'm writing it down in different. I'm like, that's kind of the same thing I just wrote down, but it's a little bit of a different way, which I found interesting.
Yeah, and I think that's okay, because we do think about information in different ways and realize sometimes, oh, I thought that was different, but it is kind of connected. And making that awareness, sort of that metacognition, is huge when it comes to learning. And I was going to say, like what Kate mentioned about just like, okay, it's a little scattered at first, and then it starts to get more organized. So what normally happens is the first couple minutes are easy. You've got some things on the top of mind that you just heard, write it down, the main points, and then it gets more effortful. It gets a little harder because you're having to dig deeper into your memory to think about, what did I hear? And then sometimes you might go a minute and not much is happening. You feel like, I think that's it. And then suddenly something clicks and you're like, oh yeah, I remember. Oh yeah, we talked about this topic. And then another little like floodgate opens and you get more information coming out. So the reason why I wanted you to think about it from memory is because that is a form of retrieval. It's perhaps the simplest form. You look back and you think, what did I do? What was it about? And the more that we have to actually sort of trace or retrace the steps in our mind, the more meaningful it will become. And then the deeper the pathways are sort of being formed to help us remember it in the long term. So what I also recommend is anytime you've been to a class or some sort of presentation that is important, take some time to think about everything that you heard. You might have taken notes, that's great, but just think from memory. What can you actually pull out of your brain without any cheats, and make sure that it's coming through on your own. So I have another task for you. Maybe I'll give you about 3 minutes on this one. So think back to a week ago. That would have been a Thursday, May 20th. What did you do a week ago? Just think through everything that happened in your day and write down what you remember. Never take the time to actually think about it. And unless we've actually replayed that in our mind for some reason or replayed that event, it's really hard to remember things that happened more than a day or two ago, because our memories they fade. They start off strong and then they fade away. So unless it's something special, yeah, it's going to be super hard to remember. But yeah, oh my gosh, Laura, that's exciting and sad all at the same time. So a very eventful day. But the point I want to make is that it's worthwhile to take the time when you're actually trying to remember information. When you're learning it, you may ever not actually know what is going to be the most important in the future. We assume everything that your teachers are sharing with you is important and you may need to use it at some time, but you might not get to apply it right away. And so that's where we have to make that conscious effort to retrieve those memories and interact with that content until maybe we get to do so in a real life setting in applied ways. So let me actually begin the bulk of this presentation, which is what is retrieval practice and why it works and how to use it. So thank you for bearing with me on this exercise so far. So how many of you love tests? I can't really see your hands raised, but I'm assuming tests are not your favorite thing. And so what I want to test you on is out of these 4 categories, I'll ask you to put your answer in the chat. What do you think is a better strategy? So by study, I mean, it's just the act of reviewing information, like reading or listening to somebody talk about it. And testing is the act of retrieving information, like pulling something out of your mind from memory. So we've got our options are either you just study, and then you test yourself, or you study a little less and then really test yourself. So I've got a lot of 3s and 4s. And so you're all in the right ballpark. The answer, the best method for actually retaining and remembering information is number 4. That's a lot of testing. And I hate that we use the word testing sometimes because it has a really bad rap. It has a really bad reputation, but I'm going to explain why testing is a lot better than just studying. So, we know that you get a lot of anxiety when you're thinking about tests. We know that learning is more about making mistakes. We need that trial and error, and opportunity to correct our actions to show improvement. And so yes, saying you're testing yourself, it creates a lot of anxiety, like you've got one chance to make a good impression. You either know it or you don't. And you don't want to be penalized for it when you're still in the learning process. So first of all, I want to change your perceptions of what testing actually is and how we can use it in more helpful ways. So this is a list of common study strategies that students report using, with the number 1 being rereading. And so you're preparing for a test or an exam, and students were asked, okay, so what do you do to actually study the information that you learned in class? And hands down, the majority of students said, I reread my notes, I reread the text. Rereading. Not great. And the reason why is that reading is very passive, and anything that's passive has very little benefit to learning. It doesn't help you remember it. So what do you think might be better strategies for using? And I'm definitely going to explain why, but just I'm curious. Feel free to type in the chat. I think you're starting to get the message I'm laying down. A lot of the rewriting, practice notes, practice recall. I know I'm not very sneaky about any of this. So highlighted or circled here are the main strategies that we would say are actually much more useful for learning and remembering information. So the reason why practice problems are useful, why it's a lot more active, is because it is a form of like testing yourself. A practice problem is almost like giving yourself a practice test, and you have to come up with the answer from your own brain. Flashcards are, it depends how you're using them, but if you've got like the definition on one side, or a vocabulary word on one side, the definition on your back, the idea is that, okay, you have to test yourself and pull that information from memory, and then you check to see if you actually got the correct definition or something like that. I like what Melody's added about walking around. We're not going to get too far into the physical aspects of memory, but it definitely does help if you are, there's a lot of reasons why movement can be helpful for learning as well. Making outlines is very useful because you're interacting with information and you're having to process it in a way that puts the information, it either is summarized or synthesizing the information. So you have to think about everything that you're given and almost reformulate it in a new way, which is very active. Practice recall is similar to what you're doing in some of the flashcards, for instance, but it is just that effort of, okay, I'm asking myself what we learned and I'm just thinking through, just like we did that free recall connected with what you learned earlier. Any type of recall is going to be useful. And real life examples are a very applied way of interacting with information. And usually it's within a context and within a setting. So it helps you or makes you think about the situations and scenarios rather than just like looking at information. You have to process what else was happening. So I think we're on the right track. So what I want to make sure we start off sort of early in this presentation is cramming. And so this is also what a lot of people do when they're studying or preparing for a test. So I'm going to pick something fun sounding like biostatistics. So I'm going to take this biostats exam. I know my exams this morning. I stayed up all night. I had this review sheet and I just reread everything that I needed to remember for today's exam. I might actually do really well on this biostats exam because I have crammed that information in. It is on the tip of my tongue. It is right at the top of my brain. And so I can totally access that material. The problem is it has what we call low storage strength. So if I never really learned it well, and maybe I heard it in class, but then I really just kind of like left it behind, and then I studied the night before, did well on the exam, that doesn't really mean that I know the material or will be able to remember it the next week or the next day, certainly not the next month. And so if you've never learned it truly and put it to memory in the first place, it's not going to help you in the long run. So often what gets crammed gets forgotten. So another example might be, I lived in South Korea for 5 years. I taught English there. And right now, I'm very rusty at Korean, which I spoke really fluently once. If I went back to Korea, I have a feeling after a couple weeks, I could pick it up really well and I'd start to remember things that I hadn't in a long time. So my Korean has high storage strength, but low retrieval strength. So it's there, but because I mastered it once, but then I didn't use it, I've kind of let it get buried. It's still there, but I need to uncover it. So buried is not the worst because you've still got that opportunity to bring it back. And a lot of things that you may feel like, I don't remember how to do that. If you really learned it well in the first place, it's a lot easier to bring it back to that forefront. The goal, however, is we want the increased storage strength and we want that increased retrieval strength. And together, that's what leads to mastery. So when you are when you are practicing your craft, As nurses, day in and day out, there's going to be a lot of things that right now might take some effort that you don't know super well. But as you use it more, then you're going to be like, yep, I don't even have to think about that. I know it. I have mastered it. Another good example might be like, remember the days when we used to travel and spend maybe a weekend in a motel or a hotel? You probably remembered your hotel room number pretty well if you had a multi-night stay. You can pull it back. Great. You know that you're staying in room 113 this week. No big deal. But the next week, you probably don't remember your hotel room number anymore. I can't remember any hotel room of any place I've ever stayed, and I don't usually write it down. But that's just normal. It's crammed in, surface level. We retrieve it a lot in that short period of time, but we didn't give ourselves long enough to learn it long term. On the flip side, something like your childhood phone number. And I hope this still applies if you didn't grow up with a landline, but I did. And of course, I had to remember my phone number to call home. I still remember my phone number from childhood. But if you never had to remember it or memorize it, and you didn't use it over and over and over again for years, you probably wouldn't remember it now. So that's just some differences between how information is crammed or either retrieved a lot or gets buried and gets forgotten. I'm looking just at the chat because I know all of you have some great perspectives to share as well. I like, what Abby's saying about the sights and sounds that are connected with where you study does have a triggering effect. And there is research around how studying in the same place that you take the exam could also be very meaningful. That is sort of, it applies and doesn't apply in different ways now that we're remote for so much of what we do. But yes, certainly smells or sights or the experience of what is in a room can place us in that mental state that we started with. Questions about cramming so far? None of you are going to cram anymore. You're just going to memorize it. You're going to really learn it. Long term. You're going to study every day until you've got this. That's sort of the goal. So let's get into some details. I know I didn't give you a long chance there to ask questions. Everything takes longer on Zoom, but feel free to type anything in the chat or wait till the end and we should have time for questions then as well. So I don't want you to just take my word for it. I want to share some statistics and some evidence about how memory and recall actually helps you with long-term retention. So here's an example of a test that was given to students. They were randomized. They were asked to read a short passage of text. And so then they were put into different groups. One group was asked to just study it, like 5-minute, just keep studying it, either rereading it, just look at that information, really put it to memory. The other group was asked to study 3 times, like reread the information, and then test yourself with a type of recall. And then the third group was asked, like they gave it to them once, here, study this material, and then test yourself at least 3 different times. And in the short run, when they were asked to do a test, a recall test 5 minutes later, the group who did more time testing didn't remember it as well because maybe they just hadn't really learned it in the first place. But then these same students got a memory test a week later. And those who had only spent the time studying up front did not have nearly the retention that those who spent more time testing themselves did. So it doesn't always seem to make a big difference right away, but even just 1 week later, you're going to have a lot better, a lot stronger connections to the material that helps it stick rather than just being able to regurgitate it word for word right away. So this is our goal. We don't want you to just remember it 5 minutes later. We want it to stick for a week. So, knowledge check. What is the most common strategy students report using? Not the best strategy, but the most common strategy. Thank you all. And I'm giving you some of these tricks just because this is a type of retrieval practice. Anytime that you can quiz yourself or test your knowledge, maybe you just read some information, you just heard some information, ask yourself a question to double check how well you remember it. The act of thinking of questions is a good exercise, and the act of coming up with the answers is a good exercise. So the answer is B. Most students say that rereading is what they do, and that's where they spend most of their time. So when students complain about how much time they spend studying, they might not actually be spending the best type of effort in their study. And I don't want you to waste your time. We do know studying is hard work, but we don't want you to waste your time doing it the wrong way. So what would be a few examples of more beneficial study techniques that you could do instead of rereading? Just feel free to type in the chat. What everyone's saying, all really good examples. And again, this isn't about showing me that you know the answers. Yes, there's always part of that when your professor asks you for input or to generate answers. But what this is also doing is it's forcing you to generate that information that will help you remember it long term. So yeah, this is insightful, gives me information about what you understand, but ultimately forcing yourself, and it might seem really easy right now because you just heard it, but forcing yourself to think of these answers is going to help you in the long run. So let's give you some examples of a medical setting. And so what this study was done is it was fourth year medical students. And so they were given different types of activities, including one was just rereading information. One was a set of context-free multiple choice questions. And so there was no like case study or elaboration. It was literally just question answer. And then there was a set of context-rich multiple choice questions. So the difference might be if it's context-free, it literally asks, what is a normal blood pressure? But a context-rich, it might give you the examples of like, so here's a patient, a female in her 30s, she has diabetes, and this was her blood pressure. Is this healthy or not? So you've got more information to go on to think about the connections, thinking, well, what's all important if you're trying to determine whether it's not always black and white. And so, yes, there's some healthy memorization that happens, but the more you see in context, the more that you're actually able to use the information and connect it to all of your knowledge. And then the last type of question was short answer questions. And so what happened is students were given these different types of study activities and then asked to take mock licensure exams. And so those who were originally given these context-rich multiple choice questions, and we like these because they can be easier to grade, but they did really well. They did better they did the best on their actual final test. Those who were also given short answer questions did much better. They were given a question and just asked to just type in. It didn't have to be long, but they had to generate the answer themselves instead of just recognizing it from a list. And those who were given context-free multiple choice questions or just asked to read the information, and that's how they studied, they actually did the worst on their mock licensure exams. So when you're thinking about how to test yourself or how to quiz yourself, these ideas around generating information or thinking about situations in context is going to be really useful for your learning and your studying. So the next question that gets brought up a lot around retrieval practice is what is the best type of retrieval. And so we've got two different categories, one being spaced retrieval and the other called massed retrieval. Any guesses? What might be better than the other? Do you have any ideas why? It's okay, hold that thought. We're gonna explain. So spaced retrieval is the idea that between those retrieval practices, between the effort that you're spending recalling information, that you let some time pass. Massed retrieval is a type of cramming. So maybe you are studying the night before and maybe you're asking yourself quiz questions, but you just keep redoing the same questions. I've got a list of questions, I make myself think of the answer, or I'm going over flashcards. You might go over them 10 times, but that's not going to help you learn it long term as compared to spacing out your practice. So what happens? Is there an optimal spacing lag? There actually is. And it all goes back to the idea that when you're studying, if you haven't mastered it yet, you need to make sure that it takes some effort to remember that information. If you don't have to think about it, then you're not really practicing. So the masked, the one at the very bottom on the left, yeah, not a good idea. I mean, it's better than nothing. It still might get you an A on the test tomorrow, but it doesn't help you learn it for the final exam at the end of the semester. So getting no space in between your studying isn't great. A lot of people will think, well, I want to make the spacing equal. So I will set it on my calendar that every Monday from 4 to 9, I'm going to study this for this class, or I'm going to quiz myself, test myself over this material. It's not the worst, but this equally spaced retrieval isn't great either because it becomes more like a habit. And so it's like muscle memory. It's not horrible, but it doesn't force you to actually think about, oh, could I remember this information in other settings? Just like I always study in the same room with the same smell. That's great. It does help you, but long term, you're really not challenging yourself. And so by expanded retrieval, because we know if you've just learned the information, it's not in your long-term memory yet. So you're going to need to probably review it, not only at the end of that class, but the next day. And it's still going to be effortful to remember new information the next day. But after that period, you've studied it once, you've studied it right away, you're going to probably remember it a little better now. So then the next period might be, well, then wait about 3 days before you test yourself again. Great. You remember it again. You probably forgot a little, but then you were able to bring it back. And then what I'd say after that is wait a little over a week, wait like 8 days, and then test yourself a third time. And by then you should actually really start to remember the information. So the idea of expanded retrieval is we have to continually make it more effortful. If we wait too long, it's too effortful in the first place and we don't remember any of it. And so then we actually may have to restudy the information before we can test ourselves on it. Now, this is still somewhat debated. What's the ideal timeline? But it really is about the overall amount of time you want to remember something for. So they say that spacing of retrieval practice is usually best about a 10 to 20% of that retention interval that you're aiming for. So if your target is, I want to remember this in a week, you should be studying like the next day after you first learn the information. But if you want to remember it in a year, you should be studying like 2 months. So that's just an example of how it really does depend on how long you want to remember it. So another example of how spaced retrieval was used in a learning situation. So there was a test given with foreign language words. And so students were asked to memorize a list, see how well they could remember a list of new words in a foreign language. Those who studied once remembered almost nothing. Those who gave themselves a recall test and forced themselves to think of the answers from memory, they did about as well as those who recalled and did that repeated massed recall 3 times in a row. Not a big difference, whether you practice recalling it multiple times, all back to back, or if you just test yourself once. Now, those who spaced out their recall did, by and large, the best and remembered that information a lot longer than those who had crammed in the first place. And yes, I'm happy to share. I'll make sure that your leaders, your faculty have copies that they can share with you. So of the slides. So what's better, spaced or massed? And I give some of these tips because we know that your faculty have a big influence sometimes in how you're interacting with information. But your class is only a limited amount of time. And as much as we want you to leave this hour-long presentation, remember everything, we know that like memories don't work that way. And as Maddie says, yes, we need to space out our retrieval practice. And so it's going to take some effort on your end to set up, I'm going to give you some suggestions, set up ways that you can interact with the material and continually test yourself in meaningful but effortful ways. So why is spaced retrieval better than massed retrieval? If you want to unmute yourself, that's fine, or just type. And so, yeah, Monica's got the right idea. It is better for long-term memory. Yeah, exactly, because it makes you work. It makes you work in active ways. And so this is why even what others were saying earlier around explaining what you learned to your husband, like that's a great method for remembering information. Having to explain it to somebody else is the form of recall that can help. I like it. We've definitely got some brain nerds in here. We do need that rest to help the information download. Great. And yes, some of that randomness is definitely important. So what I like to suggest in applying these retrieval practice techniques is to quiz yourself regularly, but again, make sure it is randomized just a little bit so it doesn't just become like you're not thinking about it anymore. You have to make yourself work. I also think it's really important to revisit some of the earlier concepts that you learned in class. So whether it's a part of your daily, weekly, or monthly study practice, I would set it on my calendar, even make a plan with friends to go back and not just study what's on a certain set. Sometimes we think it's a benefit when we only have these small tests or these small exams that quiz us on very specific information. The more that we can actually make ourselves go back and retrieve information, the harder it is. And the last point being, don't just reread or highlight information. You have to practice generating answers. The other point that I think is really useful is on feedback. So what happens if you do test yourself and you don't get the right answer? So in this research study, 133 psychology students were given an initial test, and then 2 months later, they were given an unexpected test on the same information. And the test was a simple, it was a 10-minute multiple choice, I think 24 question test. It was some short videos that they had to watch, then respond to like fill in the blank questions. So what happened, how they divided these groups is half of the students received feedback after the initial test. They did have a control group, and then half the students didn't receive any feedback after the initial test. And it wasn't fancy feedback. It was given like a day later, 24 hours later. It involved a PowerPoint slides, and the lecturer basically read information. He read the question and then waited for a response from the students. It was approximately like 15 seconds. And then he'd show the right answer visually and then repeated it out loud. So the answer for question 2 was C, whatever the answer was. They did this, just went through each of the 24 questions. It took like 4 minutes in total. So what this was doing, it was a type of cued recall that they had students perform. So I ask you the question again, and then I have you recall, and then I tell you if you're right or not. And what that did was increase the amount of correct answers on that final or that 2 month later exam exponentially. Note that for those who initially got certain items correct, like the feedback didn't lead to improved performance, but it was especially on focusing the answers that the students didn't get correct. So maybe they still didn't know it in the first place. And so even the teacher, there was some work done where they only focused on sharing answers that were gotten wrong. If everybody got it right, they kind of skipped those questions anyways. So it is interesting. And also maybe worth noting is this study also tried some collaborative group testing in the experiment, and that didn't help at all. Solo testing led to a lot better long-term retention. So what does this mean? How can you apply some retrieval practice techniques in your own studying? So I want you to think about some ways that you can connect the information that you heard here today and make a plan for how you might actually use it. Feel free to share if you've got some ideas.
Do you want us to like share out?
Sure.
Sorry, someone else said.
I was going to ask a question.
Yeah, go ahead.
So, when my train totally derailed. Never mind. Sorry.
You're fine.
Oh no, I hate when that happens. I was just going to say that someone mentioned this earlier, but the flashcard app Anki actually does utilize the spaced recall of the 1-3-8 interval. And so I would suggest that for someone who is looking for a flashcard app. It's not free, but I watched a YouTube video about it, and like it was pretty much exactly the same as your presentation in terms of explaining like the best practices and like why what it works. And so I'll be using Anki hopefully every day so that it can like solidify the information over a long period of time. It's called Anki, Anki.
Awesome. And I should admit that the fact that you've made it this far in your education, I mean, you've been doing something right. So obviously you're not complete novices to how to study and how to learn information, but it's something that not a lot of us are actually ever taught. And so sometimes we don't know why something works or why certain things work better. And in like the idea of having flashcard apps or setting aside, like Brittany said, those regular quiz dates, like I'm just going to set up this time to always quiz myself. Now that can still work, even though I said like, don't make it too much of a habit, like make it random. What I would do in that situation is focus on different content. And so it's not like I'm studying the same thing every week at the same time. It would be like, okay, I'm mixing it up. So what they call interleaving. So when there's other information, like, yep, I've learned these new things, I'm going to add that in. It does help to make things more effortful, but ultimately then it does actually help our brains make new connections to other information that we've learned or are learning. So I love all these suggestions, and I hope that you follow through and stay dedicated. And I know a lot of times when I first share these ideas, I used to work specifically with undergrads who are new to university, first generation, and they'd be like, oh my gosh, why is studying so much work? And it is. And it's even when professors will add in more sort of the testing effect and have more quizzes in their class. It's really useful. Like, we know it's good for you, but we know that students don't like it. If I say, yep, you're going to have a quiz every day, it's so I can help you check your knowledge and force you to remember and apply and recall information. But we know it's not fun. And that's the whole point. Learning and studying, if it were easy, then we're not actually remembering it. We're not actually learning it. So it has to be effortful. The value, the benefit is that ultimately, once there will come a point that you've mastered it and that you don't have to think about it anymore. And I can ask you a day from now, a month from now, a year from now, and you're going to know that information. Even if it gets buried a little bit, it'll be like, yep, actually, it's coming back. I've got it. And that's a really rewarding factor. And that's what's going to make you masters in your field and skilled at everything you do. So if you do want to learn more, here's some resources that I find really useful. A couple books on the right-hand side, some of my favorite books around just how learning works and ideas around using retrieval practice. And then there's a whole website for students and teachers on retrieval practice, why it works, and how to use it, with templates and ideas and suggestions all about that. So that is officially everything that I wanted to share, but I'm happy to answer any questions if you've got some thoughts. Thank you for being a good audience. I know it's hard to sit on Zoom so long.
I have a question.
Yeah.
So we talked about how rereading and rewriting weren't the best techniques. But I have heard that like electronic flashcards versus handwritten flashcards, or even like a handwritten outline. Is that true that it being handwritten is better?
Yeah, and so that what happens sometimes is like, okay, if you're just rewriting it and you're not thinking about it, it's not the best. But what happens often if you are rewriting information, and there has been some really new research lately that says, okay, don't totally debunk the idea, like we've heard for a long time, handwritten notes are better than typewritten. Not completely, but what does help is if you are able to make your notes a little more visual. And there's different ways people do that. And for most people, it's the easiest by doing it by hand, because you're able to personalize it a little more. I think like bullet journaling is really popular these days, and people encourage like make little drawings, or when you can use different colors or symbols that help you connect with the information, that's making it a little more unique. And so that's helping it to stand out in your brain a little more than just like passively rewriting it. And again, it's not like you can't learn it. Even rereading, it helps you learn it, but it's not maybe the best long term. You have to do more than that. But just to answer your question, Maddie, yes, handwritten is definitely, for most people, tends to add a layer of what we call, I guess, personalization, that helps trigger some uniqueness rather than just reading it off of out of a textbook or reading typewritten notes. You're like, oh yeah, like it's my drawing, it's my handwriting. It connects you to that place and time where you were interacting with the information in a more unique way. I hope that makes sense.
Yes. Thank you so much.
Alexis, I have a question. Sorry, I remembered kind of where I was trying to go. So when we're doing initial reading, like before we even go to class, especially thinking in the context of like this summer where we've got quite a few classes and really heavy content. Is there, using this same type of methodology in an active reading sense, is there a way to kind of incorporate the same concepts, or like is reading just true? I mean, it doesn't feel passive to me, but is it really that passive?
Well, so there's a little difference because you still have to absorb the information somehow. You still have to be exposed to the information. So you do have to start by reading it if no one else is reading it to you. And so what I would suggest, and I do think that's beneficial, if you're able to read it and ask yourself questions, think about what you understand or what you don't understand. Even trying to quiz yourself already will help you determine what really makes sense in your mind or not. What they also say is a lot of times reading material before you go to class will help you be more engaged because you're already starting to think of connections like that didn't make sense, or is that what they mean? And so then I'm going to be more primed to want to ask my professor if just for clarification to either to verify or like dissuade my initial response or thought about what it meant. So it also makes you more primed or more engaged to like, ooh, I have another question because I've already thought about it a little bit. So it can make your time in class be better spent in actuality, and can help to sort of confirm or deny what you thought something meant, which is already taking you to that sort of next stage of getting feedback on what you've put in your mind, if that makes sense.
Yeah, thank you.
Yeah, it's like it helps us move past that true just absorb, like, yep, got to get the information, and helps you move into that recall a little faster. So even when a teacher is explaining it to you in class or going over it, or you're asked to use it in exercises or homework assessments, you're already starting to use that recall to move yourself past the initial absorption phase. I know you have lots of, I know you've been given so much information today, but I love kind of seeing the excitement for this big challenge that you are signing up for. I know it's not easy, but I know you can do it.
Alexa,
and I like what Ava's sharing too. Some of those notebooks, like you can keep it online, but you're still like handwriting or scanning the pages, so you have it for accessibility. So it's on the go. All that good stuff. All right, I will share my slides.
Yeah, thank you so much again for your time. I know you're really busy. We really appreciate your help and support.
My pleasure. I love geeking out over this stuff. Good luck with your programs, everybody.
Have a great afternoon, Alexis. Thank you.
You too.
So we're just going to shift gears here as we're going into the last hour. The last presentation we have before we introduce you to some additional campus resources is Kelly Timon is joining us, and she is a case manager with Campus Student Services. And we've asked her to join us today to talk a little bit about case management and more specifically the care team. So Kelly, thank you so much for your time and thanks for joining us.
Absolutely. Thanks so much for having me. Welcome, everyone. Let me just share my screen real quick. Right. Wonderful. Well, hello again. Thank you so much for being here, everyone. I know you've had a lot of information today, so I'll try to keep this short and sweet. My name is Kelly, and I'm a case manager in the Office of Case Management. I'm going to spend about 10-15 minutes talking to you about how our office can support you during your time here at CU Anschutz. And if you have any questions, please submit them in the chat, or you may ask at the end of the presentation as well. So in a nutshell, our office is here for you when life happens, and life happens to all of us. This year has been a prime example that not only does life happen, but it can happen unexpectedly. Our office is here to remind you that when life happens, you do not have to face it alone. We can help you navigate challenging experiences and situations that may impede your ability to be successful, both personally and professionally. We are committed to fostering a culture of care at CU Anschutz, which simply means that we care and look out for one another. We are committed to the success and well-being of all students. We collaborate with you and all the schools and colleges to ensure that students are connected to the resources and services necessary to meet their needs. Case managers provide support by meeting with students to assess their needs and identify appropriate and helpful resources to meet their needs. We then make referrals and help students get connected to said resources. We also provide advocacy and follow-up services. One of the programs that we help with is the medical leave of absence process. At CU Anschutz, we prioritize you and your well-being. So this process is intended to help students take the time they may need to attend to their health and wellness. Our office is highly collaborative. First, we collaborate with students. We believe students are experts of their own experiences. We employ a strengths-based approach to empower you to contribute to your own care and influence your outcome. We also collaborate with your program to identify additional supports that may be available to you. CU Anschutz is a big campus with a myriad of departments and resources. It can often feel overwhelming to navigate. So if you are feeling stuck and do not know where to start, please connect with our office and we will get you to the right place. Here are a few common resources we help connect students to. Student and resident mental health for counseling and other mental and emotional support services. The Phoenix Center supports anyone in our campus community who may be experiencing interpersonal violence. Peer coaches are trained to help students identify their strengths, motivations, and passions, and to target areas in their lives they would like to build upon or change. The Office of Equity helps prevent and address any issues of discrimination, harassment, sexual misconduct, and any related retaliation. The Ombuds Office is a confidential and non-biased resource where you can discuss any university-related concerns. The Writing Center offers help with writing of all kinds, including research essays, proposals, dissertations, cover letters, grants, personal statements, residency applications, and much more. The Office of Disability Access and Inclusion helps students request academic accommodations such as extended time. Financial aid can help with loans, scholarships, and student employment. And CU Anschutz Shares and the Student Food Pantry are housed within our office, the Office of Case Management. So I'll cover those in more detail in a few minutes. First and foremost, trust your instincts. If you feel that you or a peer is experiencing a situation that requires supportive attention, please submit a referral. If you notice any concerning signs within yourself or a peer, submit a referral. If you do not know where to start and feel stuck, or if you are not sure what resources are available to meet your needs, submit a referral. Or in other words, always submit a referral whenever you feel additional support may be beneficial. We are here to work alongside you and our campus partners to ensure your success. There is no situation that is too small or trivial to refer to our office. I'll repeat that again because it's so important. There is no situation that is too small or trivial to refer to our office. If you ever have questions or need help deciding whether a referral is appropriate, we are available for consultation. And it's always better to err on the side of caution and report behaviors you think may be of concern. If there's an imminent danger to the safety of a student or others, please call 911. So here are 4 key reasons we should all make a referral whenever necessary. 1, because you're in classes, labs, study groups, and spend more time with your peers, you will likely notice signs before anyone else. 2, you'll be helping to address challenges before they escalate into a potential crisis. 3, you're helping to collect the data and information necessary to identify any gaps in student support resources. These data points support advocacy for the development of holistic, meaningful, and effective resources and programs to support student needs. And last but certainly not least, refer because that's how we continue to create a culture of care on campus. We all have a role to play in ensuring our community is a healthy and safe environment where everyone can thrive. So referring is very, very easy. carereport.cuanschutz.edu will take you directly to our online case management referral form. I encourage you all to go to that link right now and bookmark it so you have it for the future if you need it. Anyone can access this form and send a referral, and that includes staff, faculty, parents, friends, and other concerned individuals. When our office receives a referral, a case manager reaches out to the student to introduce themselves and offer to meet. Students always have the opportunity to decline our help. Meeting with us is optional. The case manager also follows up with the referring party to confirm receipt of the referral and to gather additional information if necessary. A response may be required from the referring party in order to move forward, so please always check your email. Your school email is the university's main channel of communication with you, so please check it often. You have the option to submit an anonymous referral if that's preferred, and there are 2 ways to do that. The first is total anonymity, where you provide no contact information on the form. Please keep in mind that this option can hinder student support because it gives us no way of following up with you should we need additional information. The second and preferred way to submit an anonymous referral is to provide your contact info, but indicate that you do not want your identity revealed when we outreach the student. Students are often very appreciative knowing that someone cared enough about them to refer. It's worth repeating that our office is not an emergency service or crisis center. We are available 8 a.m. to 5 p.m. Monday through Friday. If you do have an emergency, please call 911 and then follow up with a referral so we can provide additional support. So you might hear the names case management and care team used interchangeably. While they are related, they are 2 separate resources. The Office of Case Management is the gatekeeper of the care team. All referrals go to the Office of Case Management, but very few referrals are elevated to the care team. You will probably never interact with it. The care team is a group of interdisciplinary entities who proactively and collaboratively help manage potential disruption to the campus community. There is a representative from the Office of Equity, Campus Police, University Council, Student and Resident Mental Health, among others. And the focus of the care team is on collaboration, advocacy, and support. It is not a punitive process. The food pantry is available to all enrolled CU entry students, as well as staff and faculty who may be experiencing food insecurity. It is located in the University Police Building, which is west of campus, near the Health and Wellness Center. Hours are currently Monday through Friday, 7 a.m. to 5 p.m., and follows the university holiday closure schedule. We stock food, hygiene items, and pet supplies to meet various needs. There are no restrictions on the number of items that can be taken or limits on food pantry visits, so please take advantage of this resource if you are in need. If you would like additional information about resources, simply submit a referral and a case manager will help you navigate resources. CU Entry Shares is available to all students enrolled in at least 1 course. It is there to assist when times get rough and finances become a burden that may hinder your ability to be academically successful. Sometimes students wonder if their need is serious enough or important enough, or they don't want to take money away from others. I just want you to know that this program was created for you. So if you could use the help, please apply. The worst that can happen is that you are not awarded any money. And the best thing about this resource is that the funding provided is a grant, so you don't have to pay it back. Helping professionals are often very other-oriented. We see ourselves as help givers and not help takers. It comes naturally to take care of everyone else while neglecting our own needs sometimes. But the truth is that taking care of our needs and practicing self-care is part of what makes us good helpers to others. We cannot show up as our best selves when we are not at our best mentally, physically, emotionally, or spiritually. So please prioritize yourself and ensure that your health and wellness needs do not take a back seat. I also want to acknowledge that seeking help isn't always easy. It can sometimes make us feel vulnerable and uncomfortable, maybe even weak and helpless at times, but I encourage you to challenge that notion and reframe it. Someone who seeks help and support is someone who is self-aware, keeps their goals at the forefront, and is claiming their power and taking control of their outcome. So please remember this as you move through your academic journey and in life. It is okay to ask for help. There are so many resources available to support your success while you're here, and I really encourage you to take full advantage of them. So here we have a quick summary of the Office of Case Management. I encourage you to take a photo or a screenshot, whatever makes sense for you. And I will take questions right now if there are any. You can put them in the chat or unmute yourself. And if there are no questions, I just want to say thank you again so much for your time this morning and have a really wonderful summer.
Thank you so much for your time, Kelly. This is Amy. I know we have some of these resources on our online Canvas shell, but would you mind sending me the PowerPoint as well so I can post a PDF of it?
Absolutely, I'd be happy to.
Thank you.
I'm looking in the chat box. I'm Julie, who handles potential leaves if a student gives birth during the program, and that usually falls to me. So we work with our students and see where that falls in their program and work out a plan with them. Any other questions for Kelly?
Thanks again, Kelly.
Awesome. Thank you so much for having me. Thank you, everyone. Good luck going forward. Have a great summer.
Thanks, Kelly.
Bye. Take care.
So we've got a little bit of time here before we shift into introducing you to some additional resources. And I know that some students are wondering about tutoring resources as well as kind of financial aid. Are there any other questions about health assessment structure for summer before I go on to the other questions, just while we got Dr. Spencer here? And she'll also be providing a presentation on Tuesday. It's your first session for orientation, so there'll be time at that point as well to ask further questions. And with regard to the schedule, I will comment on that. I'm still waiting to hear back from the experiential learning team about the schedules, but again, you'll be receiving your schedule for that one 12-hour shift at UC Health, and then you'll also be receiving the weekly on-site virtual clinical schedule. And I don't know exactly when those will come out, but I know that I think the schedules are pretty well set. So just stay tuned to your CU email to get that information.
Yep. And some of the questions, do we start phlebotomy this summer in health assessment? Dr. Stephen, do you want to talk about phlebotomy?
No, we do not do phlebotomy in health assessment. We do in foundations. You will be learning injections, starting IVs. So that starts in foundations, and that would be late August, early September. So stay tuned and get ready. It just keeps rolling out, but not in health assessment.
Yeah. Shelley, for remote clinicals, are they synchronous or done on our own time? Are you talking, Shelley, about the on-site clinicals in CEC? If you're referring to the on-site CEC clinicals, they are synchronous. Let's see here. Registered for summer, but I still haven't seen a class schedule. So the class schedule will be on the main College of Nursing website. I believe it's under the main tab is student resources. I think
it's called Student Life.
Student Life, and then you'll see the course schedule. The course itself has not been published, so we're still working on some fine details with that and hope to have it published next week.
And the other thing that you'll want to look at is make sure you refer back to that plan of study that Dan Hussey had sent you. In that email, when he sent the plan of study, you'll need to take note of your color group, because your color group will determine when you do a number of sessions for orientation next week. But also in that email when Dan sent the plan of study, he also had very specific information about your sections of the courses you're taking this summer in terms of the scheduling as well.
Mm-hmm. And as far as where you'll be placed for your offsite clinical, typically it's on a medical surgical floor. Will we have clinical during the semester break? I'm thinking you're referring to the break in August. At this time, we don't have clinicals planned for that time. Realize that as you move through your program, there's always the possibility that you will have clinicals during traditional breaks between semesters. So you could have a clinical between the fall and the spring semester. You could have a clinical between the spring and the summer semester. So realize that that's always a possibility. What days and times do we have pathophysiology? Again, your course schedule is on the main College of Nursing website. You can find it there, and that's true throughout your program. You'll be able to find days and times and where the class is being held. When can we expect loans deducted from tuition? Amy, do you know that?
So I had reached out to Joanna Cabrera Rosas earlier in the week to try to figure out when those dispersals will be, because they vary each semester, and I have not heard back from her. I know they're still working on summer award packages, and then your fall package typically doesn't come till a little bit later. But our admissions team is working very hard to make sure we get all remaining credits into the system so we can get junior status for students. So I would just stay tuned. I don't know exactly when all those packages will be dispersed or when exactly the aid will be dispersed.
Let's see here. UCD Access Portal shall have your schedule after you've registered. Is there a time we can plan on vacation or time off, or do we just need to wait 2 years? Well, we'll talk about that a little bit more in orientation. It's a little bit tricky planning time off because of the clinical schedule, but we'll talk a little bit more about that in orientation. Monica, have a great flight. Enjoy your parents. Ava, how much notice will we usually have for clinical shifts? Typically a week or two prior to your course opening up or being published, you should get your clinical schedule. That is, again, typically, that should happen. If we can't pick up our textbook scrubs this week, can we pick them up next week on the day that we are already scheduled to come to campus?
So I can take that, Dr. Spencer. So when I send out the schedules tomorrow, you'll have a better sense. As I mentioned in an earlier email, we're going to have times on Wednesday and Thursday afternoons when students will be driving by to pick up supplies and badges. And I do believe that the bookstore will be open during that afternoon, but let me get clarity from Vicki Shank, the bookstore manager, and she'll be joining us Tuesday as well, Tuesday morning. So you can certainly ask questions if they haven't been covered before then. But I believe that she will be around if you need to pick up your textbooks and scrubs. And just remember, as I mentioned in last week's email, you absolutely must have their clinical codes before orientation, because on Thursday morning is when we're going to have the training sessions with our experiential learning team to get you ready for that clinical software.
Let's see here. Josh says he's planning an August break. Yay. Kimberly, how many pairs of scrubs should we purchase? That depends on how much you like to do laundry. So we usually say purchase 2 pairs of scrubs, but if you want to purchase one and wash them in between, you certainly can do that as well. Will campus be open this summer to study? Any other suggestions on how we can get more immersion while being remote? Campus this summer, Amy, do you know about student access?
I don't know, and that's a good question. One of the presenters next week will be Ben from the library, and we can certainly ask him to address that. I think in the online Canvas shell in the library session, or the library module out there under the resources, it's got the link to the library, and we definitely say, because things are changing quite rapidly, and especially since our campus is getting a little bit more open, becoming more open starting in June, I would definitely say that's if you're wanting to come to campus to study, just check the library website. I don't know if it will be open access. In the past several months, really the last year, it's been access only by permission ahead of time. My hope is that will be opening up a bit, but you also have to realize there's lots of students on campus. So I would just say, make sure you're checking that library site before you come to campus.
Exactly. Yeah, and to your point about that, Amy, you know, the group size changes, it's been changing. It was 10 and then it was 12. And so I think we're really in a big time of flux right now in terms of how the summer's going to look like. Do scrubs have to be worn during offsite and onsite? Yes. You do not need to wear them during lecture. I think I just missed one of the chats. They're coming so quickly.
There's a question about scrub pants.
Scrub pants. Can we wear any black scrub pants? So your uniform is the uniform that's been approved by the College of Nursing. When we did our scrubs and our dress code, we basically asked several different healthcare organizations what their dress code was, and we based that off of that. And so that's why you will see a very specific dress code. We want to make sure that students will have the appropriate dress and the appropriate scrubs, no matter what facility that you're placed in. So that's why you can't wear just any scrub pants. You need to wear the ones and the uniform that has been approved by the College of Nursing. Again, we don't want any student to walk into a healthcare organization, because you may be placed in any organization across the Denver metro area and be sent home because for some reason it's not in line with that organization's dress code.
Is that jacket included?
Is the jacket included?
Is it part of our uniform? We can't use our own jackets or different types of jackets?
So the uniform should be your scrub top and your scrub pants. And then I believe the jacket that's being sold in the bookstore, you can also wear.
Okay, thank you.
Mm-hmm. Those of you who brought the bundle, is the SLS access code included in the Elsevier access card? Yes, it should be. Amy, do you know anything differently than that?
I don't, but I am not well versed in the access card. So if you have any question, you could always reach out to me and I can forward it to Vicki, or just reach out to the bookstore. Vicki is pretty responsive about responding to emails.
Can I say something? So I have my my bundle of books right now, and I got an access card for all of those included with it. There were certain books that were not included in the bundle that had their own individual access card, but from my understanding, the bundle, the card comes with it because I have one. So.
Okie dokie.
Is this, I'm so sorry, is this separate? I did the same thing and purchased the whole, everything on the pre-order form. And I got 2 access codes, one of them being the course point for patho, and then another access code. Are these different from the clinical essentials and the SLS access codes, or is that all I need?
That's a really good question, and I'm not sure that I can give you the details on that. Amy, can we just have them send an email to you or me, and then we'll get them connected with who can answer that question?
Yeah, that's a good idea. Pearl, just send me an email. And then once I have the answer, I can include it in tomorrow's weekly email to all students as well.
Right.
Okay, great. I'll also include like a screenshot of it just so I make sure I have the right stuff.
Sounds good, Pearl.
Thank you.
Adriana, about the dress code, visible tattoos do need to be covered with a long sleeve shirt. Yes. Do we have to buy the scrub pants from the bookstore, or can we buy them from another store? Need to buy the scrubs from the bookstore. I purchased everything, all the bundles. Oh, I lost that one. Purchased everything, all bundles on the proof, where I did receive 2 different access codes. Okay, Pearl, we just answered that, correct?
Yes, thank you.
Since we are remote for class, can the RTD fee and our tuition be waived?
So that too is a question that I'm going to double check with Campus Student Services, because they're the ones that oversee the RTD. I mean, when you all get your badges, next week, it will include your RTD pass, which is just automatically billed to you in the fees. My understanding is that if you live in an RTD service area, you are not able to waive the pass. But I will try to get confirmation of that. There is a window of time when students are able to apply for a waiver, like if you really do truly live outside of an RTD service area. But the last time I had checked, I think last week I checked on the Campus Student Services website, and they had the spring 2021 waiver period, but not the summer. So let me follow up on that as well before I send my email tomorrow out to students.
And Amy, this is a question for you too. If we do have access to campus this summer, will our student badges already be activated to access student buildings?
Yeah, boy, these are like, you're firing away here. These are awesome questions. Put me in the hot seat. You know, I'm not sure about that, because I do know that the buildings are going to be badge access only. As I was actually at the badging office last week and had this conversation with the person that oversees the badges when I was picking up your badges. I asked that. I just don't know what access has been granted for summer. I think that's a larger campus issue. And I think that also speaks to another student had questions about, can you have access to the study rooms? So in order to have access to the study rooms, you know, whether it's in the library or as some of you that have been to campus know, over in Education 2, North and South, as well as Ed 1, there's a bunch of really great small study rooms for students. And I honestly just don't know what the access is going to be. And I'm honestly not sure that they've determined that yet. Dr. Spencer, do you know anything more about that? Okay, so let me just add that to my list of like my ever-growing list of things to try to sort out. And if I don't have that answer by tomorrow, I would assume that we'll have the answer by next week, just so we can provide some more clarity. But these are awesome questions.
Yep, absolutely. Stethoscope, a Littman Classic is awesome. Other classes that require an access code for summer class is Patho, and then your SLS will also have an access code. Small groups on campus, small groups off campus. We're going to find out information about that.
Is there a specific color of shirt that's worn under?
That will be in the dress code. Thank
that's
you.
In dress code, okay.
Yep. Study rooms on campus, we'll find out about that. How many on-site and off-site clinicals will there be this summer? So off-site, you have one in health assessment, and then on-site, you'll get the schedule for that for health assessment. Scrub pants are still long. I would suggest that you just hem them so that they're the appropriate length. Access card. New badge, Micah, basically look on your badge. It should have an expiration date. Let's see here. We asked about the color. Patient care during our clinicals. Is it observation? Yes, you'll be able to do some patient care. Just depends on the clinical. For health assessment, we'll have very specific parameters of what you can and cannot do. I think that's it. Great questions.
Yeah, and I just wanted to respond to, there's a couple more questions out there about when is tuition due. As I mentioned in an earlier chat, look at your student portal, because that will tell you exactly when your tuition is due, because it could vary from student to student based on when you registered. I know that's really confusing. So log into your CU portal to look at that. And then I think it was Emily that asked a question about, while you're waiting for some scholarships to be mailed, like what do you do with your pending tuition bill? I mean, if you could pay it out of pocket, I would say that's ideal. And then you'd be reimbursed for when the scholarships are awarded to you. If you don't pay your bill on time and those scholarships have not dispersed, you're not going to be dropped from your classes, which I guess is the good news. But you will start to incur a percentage penalty each month that you have an outstanding tuition balance, and your account will be on hold, you know, in terms for future registration until you pay that balance. And we'll also have a financial aid session on Tuesday with Joe Cabrera Rosas, who will go over in more detail financial aid as well.
Oh, sorry to interrupt, Amy. So then with that Zoom meeting that you just mentioned, would that be a good time to then ask who I could reach out to regarding the payment plan situation that I'm having?
So I would say, Gabriel, if it's an individual question about the payment plan, I would reach out to the bursar because probably Joe Cabrera is not going to be able to answer that individual question during her hour session on Tuesday. I would say reach out to the bursar and start there. And if you can't identify their contact information, just shoot me an email, Gabriel, and I can send you the information for that office.
Okay, sounds good. Thank you.
Yeah, sure, no problem.
Awesome. So I think Emory is up next. Is that right, Amy?
Yes. Okay. So now I know it's been a really long morning, and thank you all for being here and for your attention this morning. At this last part of the session this morning, we want to introduce you to a couple more resources. And I don't know, is Nicole out there, the new peer mentor coordinator? I don't know if I saw her yet. So so Nicole, hang tight. Let me first introduce Emory Wilcoxen. Some of you met Emory, gosh, it's been, I think maybe it was last week, time's flying by, that took part in her time management workshops. But I want to just introduce Emory just quickly so she can let you know the kind of services that she'll be able to provide to students. And also I will include her email address in my weekly email so you know how to reach out to her directly so that you could schedule with her. But she's definitely one of your resources, going forward in the program. And while she is not a nurse and cannot provide nursing content specific help, she can help you in terms of thinking about study skills, maybe ESL support, time management. So Emory, do you want to just introduce yourself and say a few words? Thank you for being here today.
Yes, thank you, Amy. And wow, what an awesome program that you all have organized for the students today. I benefited from the information too. I was jotting down some notes, and I'll hopefully retrieve it well from what we learned today. So yes, as Amy said, my name is Emory Wilcoxen, and I am the Student Success Specialist for the College of Nursing. And basically, my job is to be an extra support and help to all of you guys. So with all of the information that you've been listening to today, if you feel like you would just like a little bit more help on an individual level, you can request or reach out to me to sign up for an appointment, and we can talk about some of the things you feel like you're struggling with. Maybe you want some help with developing some better study habits. We can talk about methods that you can use that will be best for you. If you're about to have a test and you're feeling some anxiety, we can talk about ways of alleviating that anxiety and best preparing for exams. Also, if you just want to feel a little bit more confident in with the content or the material that you're learning, we can do role play type scenarios, or you can present information to me, and that can just help you feel more confident with what you already know. So like Amy said, you can reach out to me directly through my email, and I would be more than happy to get to know you guys and have a session with you guys.
Thank you so much, Emory. We're so excited to have you working with us. So I think, are there any questions for Emory? And like I said, I'll include her email in my weekly email tomorrow. And as we get into the summer semester, I know Emory is going to be setting up some additional workshops that will probably be occurring maybe mid to late June, as students really kind of get into your first exams, and you might find at that point that you need a little support. So she's going to be targeting some of those sessions, which we'll share as well as those get near. Thank you so much, Emory.
No problem. And I think the workshop coming up has been scheduled for Friday 18th, so mid-June.
June 18th, okay.
On testing anxiety. So yeah, anyone who is interested, yeah.
Perfect, perfect.
Thank you.
And so in addition to Emory, I don't know, Dr. Spencer, if you want to talk a little bit about the tutors, the TAs that we have that are nursing specific content subject experts.
Right, so we have 2 TAs whose sole purpose is to help with content tutoring for patho or health assessment or even your roles class. And so they will be with us this summer. and you'll be hearing more about them and how to access them. Matt Warner and Brittany Goodwin are both fabulous tutors, and they've taught with us before, and so very familiar with the content. So again, if you're feeling that you need that little extra boost for understanding certain content areas in any of your classes this summer, please, please, please reach out to either one of them, Matt Warner or Brittany Goodwin. And again, we'll get that information out to you. My biggest takeaway point from that is please reach out sooner than later if you need help with any of those courses. And that's the perfect segue for Nicole to talk to you about our fabulous peer mentors, which we couldn't do without. So Nicole.
Absolutely. So I'm taking over as peer mentor coordinator, and so the peer mentors, each of you will be assigned one, and we are all second year nursing students. So we just went through everything you're going through last year. So we're really here to be a resource. I mean, if you're struggling with a course, then, you know, we just took it. So hopefully we should be able to help you if it's content or if it's study methods, because it can definitely feel like a lot of information coming at you all at once. And or if you just are curious about like what helped as far as outside experiences, as far as work or volunteering, you know, your peer mentors can give you a lot of advice about things that will help you during nursing school to kind of figure out what path you want to be on for after nursing school. So you can reach out to us about anything like that. We will be conducting review sessions for exams during this summer and fall semesters. So you'll get to know us that way. And then also hopefully as we find out how campus is opening up, you know, maybe we'll be able to actually meet everybody in person. All of the peer mentoring this last year was of course online. And you know, we're just as excited about you guys as getting back on campus, because most of us have never had a class on campus. So we'll be kind of learning about that with you as we go. But really, we're just here as a resource. I mean, you guys will depend on each other a lot, but if there's anything outside of what you know, or just advice that you need and want somebody who has just been through it, then that's really what we are all here for. And so all of you will be getting an email or text or something from your peer mentor as they introduce themselves. And then you're also always welcome to reach out to me if you have any questions. I know all of the orientation days can be a lot. So we'll be reaching out in a little bit after you've gotten to wrap your heads around everything that is going on right now, and kind of follow up and see if you need anything. Oh, well, I just saw a question in the chat. So how many students per mentor will depend. The application for peer mentors is actually still open till June 1st. So it'll depend on how many people apply and how many people I accept and assign. And so I don't have a direct answer for you for that. And then that question's not for me. Does anybody have any questions for me?
You mentioned applying to the program. Is that something we do, or were you talking about mentors?
Mentors, yeah. You will all get a peer mentor just by being here.
But Jamie, next year you could be applying to be a
Can't wait.
mentor to summer 2022 admits.
As soon as I survive this year, we'll talk about that, Amy.
Absolutely.
That's great. Yeah, the peer mentors are a great resource to help you get through the program.
Yeah.
Thank you so much, Nicole.
Of course.
Thanks, Nicole. So I just saw when all these thank yous pop up, it's hard to keep track of the other posts, so give me just a moment. So I mentioned in a previous email that we will be giving stethoscopes out next week. That's a gift that's coming from the College of Nursing and our Alumni Association. That's directed at Luz.
Yes, and yes, Danskos are okay.
And there was a question, I think let me look back. Molly had a question about Dr. Spencer, can you see that my schedule has roles and health assessment happening at the same time one day? I want to say that the schedule looks a little bit wonky, but it's actually not a conflict. I don't know, Dr. Spencer, can you comment on that? You're muted though.
Those are the two classes with the same times. Molly, can you be more specific? And I do think I was just looking it up online.
Hey, yeah, I'll unmute just to describe it. So it says that I have 30-23 with you on Thursdays from 8 to 12, but it also states that I have 38-80 on Thursdays from 8:30 to 12.
And which,
So
go ahead.
I wrote down the whole schedule day by day, and there are some days where there's just no Thursday classes for the other ones, but then there's Thursday classes. So like there's no days that overlap. The schedule just looks really weird.
Okay.
I think that is the correct answer, that the schedule looks a little bit off because a few students had asked Dan Hussey about it. And I think it's when you look at the day-to-day for those weeks, because I think there's just some classes that don't meet every week. So there really is not a conflict, but if you've got other questions when you take a closer look at the schedule, feel free to send them to Dan. He's the best person to ask.
Okay, thank you.
Sure.
Carmen, you're nodding your head.
I am. I know that roles only meets 5 times synchronously over the summer. And so I know that gave some opportunity for health assessment to be on the same day. It's just it's not overlapping. It initially looks that way, but you have to map out both courses.
Yeah, and I have a health assessment is Mondays and Wednesdays, except for the week of July the 4th when it's shifted because Monday is a holiday. So on that week, it's July the 6th and 8th. So hopefully that helps.
And roles doesn't meet that week.
Let's see here. Shoes.
I'll put Dan Hussey's email in the chat quickly here.
Yep. Shoes need to be a neutral color. That is true. Anything else about that? Any other questions that I can answer? Okay.
I know it's been a really long morning, and we appreciate all the students being here. We hope this has been a great session as we go into the orientation week. As I mentioned, I'll be giving you all the specifics about orientation in my weekly email tomorrow. And just know that we'll start at 8:30 on Tuesday morning with the welcome from our dean and our newly appointed director of admissions, who will be joining us that morning as well.
Yep.
So are there any other questions while you've got us on the line? Dr. Stevens, Dr. Spencer, any questions for those two?
I don't think so. Dr. Stevens, do you have anything?
No, oh my goodness. I am just shocked at everyone's engagement. I'm so excited now to be teaching this summer. Woo!
And I will, like I said earlier, because we've recorded these sessions, I will work with our webmaster to get them uploaded. I don't know if we'll have individual links for each of the sessions or how our webmaster will set it up, but she'll be able to put the recordings on YouTube, and it's a private YouTube channel that we'll be able to send the links out to students. It'll be sometime next week, and I'll also post them to the online course shell.
I do have a question.
Sure.
Before some of you guys take off, I do have that email that I got from Dan with my the plan for my progression, and it shows 3 of the classes that I successfully completed. So the